Welcome everyone to the 14th meeting of 2013 of the Public Audit Committee, and ask everyone to make sure that all electronic devices are switched off. Thank you. Item 1, can we agree to take items 4 and 5 in private?
Okay.
Thank you. Item 2 is a Section 23 report, the NHS Financial Performance 2012-13, which has been circulated to members. And can I invite the Auditor-General to brief the committee?
Thank you, Convener. This report examines the financial performance of the NHS for 2012-13. We also comment in the report on the financial sustainability of the health service, recognising the challenges and pressures that are facing the delivery of healthcare services. We publish this report annually, which allows the committee to monitor progress on how the NHS is responding to the challenges that it faces. We highlight in the report that NHS budgets are getting tighter and demand for healthcare is rising due to an ageing population, more people with long-term health conditions, and the impact of factors like the increasing rates of obesity. The way health services are provided are also changing, with technological innovation and the planned integration of health and social care. These changes present significant challenges for the NHS. We found that the NHS in Scotland managed its finances well in 2012-13. All boards met their financial targets, and overall they reported a small underspend of £16.9 million against a total budget of £10.9 billion. This surplus is just 0.16% of the total budget, and that highlights the very active management and monitoring of the annual financial position that goes on in both boards and in the Scottish Government. Given the increasing pressures facing the health service, the NHS needs to increase its focus on long-term financial planning and sustainability if it's going to successfully make the changes that are needed to meet the growing demands that it faces. Boards do produce financial plans covering between 3 and 5 years, but their detailed financial planning is limited to the first year of the plan. We've previously reported that the NHS will need to think more radically about how to deliver services in the longer term. NHS boards have started planning for this, but they haven't carried out detailed financial planning to make sure that their strategies are affordable. Boards made significant savings of £270 million in 2012-13 and achieved the Scottish Government's target of saving a minimum of 3% of their baseline budget. NHS boards also set their own savings targets to break even, and overall they made 99% of these savings. However, they did rely more on one-off savings than planned, making the challenge of finding the same level of savings in future years even harder. The report recognises that the NHS has made good progress in improving outcomes for patients, such as reducing death rates from heart disease, stroke and cancer. But there were signs of pressure in the system in 2012-13. For example, not all boards met their waiting times targets, vacancy rates for consultants and for nursing and midwifery staff increased, and boards increased their use of bank and agency nursing staff and their spending on private sector healthcare. Spending in these areas is still a small part of overall budget, but the increase reversed the trend of declining spend in these areas in previous years. Auditors also reported that the introduction of the treatment time guarantee in October 2012, which gives eligible patients the statutory right to inpatient or day case treatment within 12 weeks, has been a particular pressure on NHS boards, and it remains a challenge for the future. We make a number of recommendations in the report to both the Scottish Government and to health boards, and I'd like to highlight 2 of those. First of all, the NHS does need to increase its focus on longer-term financial planning to show how the pressures and challenges will be managed. All boards should ensure that they follow good practice, including the use of appropriate methods for modelling future expenditure and for looking at different scenarios. Detailed financial planning should underpin all board strategies, including workforce, asset management and information technology strategies. And we think the Scottish Government should also consider moving away from the current framework of annual resource limits against which each NHS board needs to break even. This would help boards to plan for the longer term and lead to fewer movements in their budgets during the year. Secondly, savings are an integral part of boards' plans to break even, so it is important that their savings plans are realistic and achievable, and boards should improve the accuracy of their short-term savings forecasts within the context of the longer-term financial planning framework. Thank you, Convener. My colleagues and I will be happy to answer questions from the committee.
Okay, thank you. And if either Angela Canning, Tricia Meldrum or Gemma Diamond wish to contribute, then just let me know. Can I ask about the impact that the financial circumstances are having on waiting times? And I refer to Exhibit 15 on the statistics to the quarter or month ended 31st of March 2013. It's clear that there's been some significant success in relation to child and adolescent mental health services and also drug and alcohol treatment. But when we look at outpatients, which is probably where many people have their interface with the health service, then there's significant failure. When we look at inpatient day case treatment times, again, significant failure, and of the major health boards, really only Lanarkshire managing to achieve targets. Accident and emergency, which is something that people feel very passionately about and where many claims are made about access, and yet we find that significant failures in accident and emergency, including in Lanarkshire, where we're told that that there's been major investment and major improvements. And actually, if you look at accident and emergency, those health boards covering the major population centres, apart from Tayside, have all failed to meet the targets. And delayed discharges are of significant concern in the areas of greatest treatment. And in the second page, on page 37, it's only the commendable meeting of cancer targets that give any glimmer of hope, if you like. When you describe what's happening in the financial performance of the NHS and some of the pressures and stresses that they're facing, not just this year but in future years, if those statistics which you've reported pertain just now, can we actually expect any improvement on tighter budgets in the future?
You're right, Convener, that the figures in this exhibit do demonstrate signs of pressure within the health system. That's one of the messages of the report as a whole, against a backdrop of lots of activity to manage the finances and to manage heat targets, access targets, the other things against which the performance of the health service is monitored. There are real pressures there. The health service is working hard to manage those pressures. That really is why we're making the recommendation that's the most important one here about the need for stronger long-term financial planning. Our sense is that both the constraints on funding for future years and the pressures coming through an ageing population, higher expectations, the impact of things like the new treatment time guarantee, all mean that the status quo isn't going to deliver the change that's required. Health boards and the government need to be really ramping up the work that's currently going on to redesign services and think more radically about how they can be delivered. And that does require, we think, better long-term financial management, including scenario planning and longer-term forecasting of the likely financial situation.
I understand what you say about financial planning, and certainly better, more effective financial planning can make a contribution. But if the issue is rising demand because of the demographic changes which you mention, linked to increasing squeeze on budgets, no matter how good your financial planning is, you won't be able to actually meet the targets if the money's not there to be able to deliver. Now, does that mean that in future we will continue to see targets not met given the squeeze that there is? Or does it mean, with the pressures and demands that you're talking about, that perhaps they may have to revise the targets because they're frankly not achievable?
We're not talking about long-term financial planning as just forecasting how much money is likely to be available, but within that doing detailed scenario planning for different ways of providing services, for example in relation to the A&E target, looking at ways of managing unscheduled care in the round, avoiding people who don't need to go to A&E from arriving at the front door of the hospital, looking at ways of keeping more people safely at home or treating them at home where that's appropriate. That financial planning is about ways of delivering services, not just understanding how the money is and what the pressures are on it. That step back and thinking more radically about new ways of doing it. And I think critically about following through on the examples of good practice we do see in parts of Scotland, making sure that they're followed up more widely is absolutely central to what we mean by better long-term financial planning and financial management.
From what you know and what you've seen, are you confident that the next time that you report we will see positive statistics in these areas, or will there continue to be problems because of the financial circumstances in which many boards operate?
We know that the pressures are real, and we know that the changes that need to be made will need to be made over a period. That means that I suspect that for the next year or two we will continue to see real pressure in these targets, and it's absolutely why we are focusing on a very strong recommendation to government and health boards to be acting now to redesign and deliver services in new ways that will help to reverse that trend.
Tavi Scott, then Bob Doris.
Thank you. Can I continue that line of questioning, Convener? Is there not an inherent contradiction between targets, beloved, of course, by politicians, and the short-term financial pressures that boards therefore operate under and have to achieve?
My view is that any targets on their own run the risk of diverting attention to one particular part of the system rather than thinking about the system as a whole. We've pulled out a selection of targets here which are targets that do matter to people and are central to the government's policy for the NHS. But we say in this report and in our work much more widely that, for example, the answer to the A&E target isn't just to look at A&E departments, it's to look at the whole question of unscheduled care, care for older people and so on. I think that the government's healthcare strategy does that well. What we'd like to see more of is underpinning that with detailed service planning and financial planning for how those changes will happen in practice against a backdrop of serious pressures, both financial and demand-led.
I agree with that, but didn't you find when you were doing this analysis and these investigations that most health boards, most territorial health boards, simply don't have the capacity or the time to do that kind of work because they're under such pressure from the centre to deliver on the targets that you've outlined in the report today?
We certainly think, and the report makes this clear, that the focus on annual targets makes that harder. Talking to my auditors in all of the health boards, and particularly the 14 territorial health boards, a lot of effort in the Finance Department and in the Scottish Government's health directorates goes into making sure that health boards hit their annual financial targets. And you can see that with an overall underspend of 0.16% against a budget of nearly 12 billion. That's very precise financial management. And we think there is a danger that that gets in the way of the longer-term financial planning and that detailed modelling that needs to happen. It's why we're making this recommendation.
But, no, that's fine. But would you presumably accept that it's unlikely, irrespective of who the government is, it's unlikely targets are going to get dropped? They are part of, for right or wrong, they are part of the NHS. So what have you suggested in terms of recommendations to ease the pressure on health boards to allow them to create time and capacity to do this long-term financial planning that you've rightly picked up this morning?
Our main recommendation is about stepping back from that very intense focus on the annual target to giving more flexibility to health boards to manage over a longer period, underpinned by strong, rigorous, longer-term financial plans. That shouldn't be about releasing control of the finances. It's obviously important they're properly managed, but it is about moving away from the focus of landing on a particular number on the 31st of March to shifting money and shifting services over a longer period to meet the sorts of pressures that we're seeing here.
Does Audit-Scotland think that health boards territorial health boards could achieve that, given the pressures they're under, I suppose, is really what I'm driving at here?
There will certainly be different pressures in different parts of the country, and you can see those pressures coming through in the detail of this report. But I think we've got no reason to believe that health boards couldn't do it, especially with support from the government shifting from the brokerage and the planning that goes around annual targets, financial targets, towards a longer-term focus on the changes that are needed in a particular part of Scotland.
Okay. And the final recommendation you make is about moving away from the current arrangements for setting annual financial resource limits for each NHS board. Do you think is government likely to accept that recommendation, or does is that not back to the same problem? They love having that control. I mean, love's the wrong word. They need that and want that financial control over health boards.
I think the indications are that the government is taking that recommendation very seriously. There are some both technical accounting challenges and also control issues that need to be managed as part of that. But I think the Cabinet Secretary, in evidence to the Health Committee, very recently gave an indication they're talking about this seriously internally, and that's certainly the impression my team have from their discussions with Scottish Government.
Thank you. Can I ask one other area, Convener, if I may, and that's on page 32 of the Audit-Scotland report on the treatment time guarantee for further pressure. Is a further pressure on NHS boards. Now, there are some statistics in relation to paragraph 73 and 74, but basically, if I read this correctly, Audit Scotland are reporting that auditors reported TTG will require significant resources to achieve and sustain Could you just give me some more detail on what you think that may mean in the coming year?
Yes, I'll ask colleagues to come in a moment. It's worth reminding the committee that we are due to publish an update on our report on the management of waiting times just next month, so we're looking closely at this against the wider picture. Angela, do you want to pick that point up?
Yes, I think you'll see from case study 4, which I think particularly highlights the situation in Lothian, where they've been investing a lot of money in trying to pick up from the backlog of patients that they had after the waiting list problems that they had in that board, investing a lot of money in trying to increase capacity and deal with the patients that are coming through.
Okay. And in 73, it's para 73, it says that 565 patients who were added to the waiting list after 1st October 2012 were not seen within 12 weeks. What happened to those 500? I mean, so that statistic is there, it is bold, it is clearly written down. What happened to those 565 patients? Did they take legal action against someone? Because that's the inference of the guarantee, after all, isn't it?
I think that's a question for Scottish Government. As far as we know, they were treated, but after the 12-week waiting time implied in the guarantee. And there is a question there about how that's managed for those patients, but also if the pressures increase and the NHS is unable on a continuing basis to meet the guarantee, we need to be clear how that will be managed and what the consequences are for patients and for the health service.
Yeah, I guess my point is that there's an audited figure here about whether there was an additional cost to meeting whatever happened to those 565 patients after the 12-week period, and whether that's been discovered or found or analysed.
At this stage, we haven't seen an additional cost to it. Clearly, it does matter to the patients themselves, and the trend will be important.
Yeah, that's what will be continued to be monitored.
Very much so.
Okay,
yeah.
Thank you.
Okay, thank you. Just before I bring Rob Doris in, can I just clarify something on the issues which Tavi Scott raised? The spending on private sector healthcare increased by 23%. It's up now to £80 million a year of private healthcare. Is that a trend that's likely to continue?
It's very hard to be definite about that. It's obviously a relatively small sum in the context of the health service budget overall, and a lot of it does relate to specific circumstances in Lothian, given the problems they had with managing waiting times. Tricia, can you add anything to that?
I think Lothian was one of the main areas where we were seeing the increase, and that obviously was to do with the backlog of patients who were not being seen within their treatment time guarantee time and their waiting list targets. So that's been a particular pressure. I think Lothian have recognised that will continue to be a pressure in this year, potentially going forward. It's something that they're working to increase their capacity locally. We'll continue to monitor to see what kind of impact that's having. But we're aware of some other boards where they also have some pressures on their capacity, where they're also having to make some use of private sector. So it's something that we will continue to keep close watch on.
Okay, Bob Doris and then Mary Scanlon.
I think that answer was quite helpful, demonstrating that it's not a direction of travel from the Scottish Government to use private health provision. It's more about very specific needs that need to be met. A local example for myself would be, a very small example, would be when there was problems with assisted conception at the Glasgow Royal Infirmary, and those who didn't get the service they should have had were given without delay service from the private sector as a specific one-off intervention. So I think it's important to get that on the record, that it's about not a direction of travel, it's about specific one-off circumstances where there has to be that intervention, and that would be the right thing to do. Can I maybe pick up some of the assertions that's been made by some of my colleagues? First of all, we've heard repeatedly the idea of squeezed and tightening budgets, and that being a consequence of some of these waiting times figures that have been put here. Now, I know quite a lot about NHS budgets, given the fact that also I'm Deputy Chair of the Health and Sport Committee. So in budget terms, I think it is important, Convener, to put on the record that we're looking at a 3.1% increase for NHS boards this year, and we've seen real terms increases over the previous year. So it's not squeezed and tightening budgets for the NHS. There could, however, be a reprioritisation of NHS resources, say from acute care to community care. So do you see the pressures on NHS being because of squeezed and tightening budgets, or do you see it because of increased demand and reprioritising of the resources within the NHS budget? Because that's an assertion that's been made about squeezed and tightening budgets.
I think there's an element of both. We're very clear that there are rising pressures on the NHS because of an ageing population, because of healthcare innovations that cost more, because of things like increasing obesity, which give rise to long-term conditions that affect the health service as well as the individuals. You're absolutely right that there is a commitment from the government to maintain health service budgets for the territorial boards with real terms increases. Those increases for revenue budgets will be very small in future, and we are seeing a significant reduction in the capital budget. I think the figures are set out in paragraph 2 of the report on page 5. I'm reaching the same stage as the Prime Minister where I can't see numbers without my reading glasses, but it is page 5. And we've tried to break that down very clearly. The other thing just to mention is that we know that healthcare inflation tends to be higher than general inflation. So the government's efforts to maintain the budget in real terms are clearly recognised here, but the pressures of things like drug costs and technology costs will increase the pressure within the health service, even against that background.
That's really helpful to give a more kind of nuanced view of the financial position of the NHS, although when you mentioned...
Can you just then, because I think it's important for Bob Doris, because he has made that very significant comment, can you just make sure that that is clearly stated on the record, that did you say that it was a bit of both, that there were financial and tightening pressures as well as the other pressures, so that the record clearly...
Convener, I think we heard that, and if the Convener would let me continue with my question... Convener, you want a supplementary on my question?
Excuse me, I'm chairing the meeting, Mr Doris. I just need to get that on the record from the Auditor-General, and then we shall proceed.
For the record, Convener, our report is very clear that the revenue budget is forecast to increase by 0.6% over the next 3 years in real terms. So there is a small real terms increase. The report contains more detail about the breakdown between territorial boards and other health boards and between the revenue and capital budget.
You mentioned that the capital budgets were decreasing, and you've accepted that there are squeeze on budgets because of the inflationary pressures on the NHS, is that correct?
Our report aims to be as clear as it can be about the facts surrounding the budget. I can run all of that through if it would help, but there are both real terms pressures from demand and a commitment from the government which is borne out in the revenue budget for a small real terms increase over the next 3 years.
Right, thank you.
Well, that was already on the record, Convener. I'll now try to develop a line of questioning with your permission. Now, I will have to now come back to the final financial position of the NHS, because I feel the Convener has yet again maybe muddied the waters in relation to it. So just for clarity, real terms increase in the revenue budget. So that's money that is spent directly on patients. You did talk about a cut to the capital budget, and it's only fair to put on the record that's in the context of a 26% cut to the Scottish capital budget. I think that provides balance, Convener, which I'm sure we're all hoping to do, and not a one-dimensional view of this report. Now, if we could move on to the next aspect in relation to your report, I see on pages 36 and 37 a number of waiting times targets, some met and some not met. Could I ask, and specifically about on page 37, could I ask about inpatient, day treatment, time guarantee and accident emergency? I see the figures were taken from a quarter, which would include winter months. I have no idea whether the answer is going to say that had a significant impact in the slippage and waiting time targets or not, but I think it's reasonable to ask that just to clarify.
We picked the 31st of March quarter because the report covers the NHS finances for 2012-13 with a year end of 31st of March. There generally is an impact from the winter on all NHS targets, but we'll be providing you an update on that next month when we produce our update report on the management of NHS waiting times.
That's very helpful. So if we were to show this from a different quarter that didn't include winter, and we need better management of winter resilience quite clearly, Ms Gardner, I would say that's perhaps what this shows, and hopefully the government's taking steps to achieve that. But could it be skewed by the winter months, this particular quarter?
I don't want to speculate about that. As I say, we chose this very specifically because it coincides with the end of the financial year to which the report refers, and there will be more information available to the committee next month with our waiting times updates.
We've also heard talk about targets and how helpful they are or aren't. Now, do you believe the NHS and government are wed to targets? The reason I'm asking this is it was mentioned by some of my colleagues and yesterday in the chamber during a health debate. The Scottish Government said it was reviewing, for instance, the target to see a GP within 48 hours because it may be having unintended consequences in general about patients accessing their GP. Are there examples of other targets that you came across which are very well intentioned, and we've already had one colleague saying that it's terrible targets haven't been met, and another colleague saying the problem is the targets. Can you identify any targets that you think may actually be having an unintended consequence in terms of forward planning in the NHS?
I don't think it's helpful for me to focus in on individual targets in that way. What I would say is that I think that having information about the performance of the health service is very helpful. It lets people running health boards, us as auditors, the people who rely on and pay for the NHS to understand how performance is changing and where there may be problems that need to be tackled. I think it's important that the government continues the work it's been doing to make these targets rounded and focus on the whole system rather than running the risk of focusing in on one area with the unintended consequences that can bring. And I think it would also be useful to continue the thinking that's going on about linking the heat targets with the outcomes approach which the government's adopted, which is generally recognised to be a very positive development in focusing on the longer term. Thinking through those linkages would also be a useful way of anchoring these targets in the longer term achievements that the government's trying to promote.
On page 30, thank you very much. On page 31 of the report, you give information on consulting and nursing and midwifery numbers, those increases in post, of which there are modest increases, but an increase in the amount of vacancies. Can we get a bit more information on that? Because I've spoken before about workforce planning tools and that perhaps NHS boards weren't planning ahead as effectively as they could do in terms of, for example, the move from acute care to community care and how quickly they could disinvest from one and reinvest in another. Does this reflect an improvement in how NHS boards are starting to do workforce planning and management?
I think you're absolutely right about the complexity that lies under these figures. They are headline figures which are aimed to give an indication of the direction of travel in the NHS. I think questions about the application of the new workforce planning tool would be better directed towards the government and NHS boards. We hope that will have a long-term impact in being able to match staffing needs against the changing ways in which healthcare is delivered in future. I don't think we can see the evidence just from these figures at this stage.
Okay. Final question. You mentioned quite rightly long-term planning, and I'm very conscious that, say, to date, for example, £300 million has been spent on the Change Fund for older people within NHS, and I think that will reach £500 million or something like that before the fund eventually is replaced and hopefully mainstreamed into NHS board services. We found out the other day there's a £100 million integration funding. You mentioned the integration of health and social care. One of the issues in terms of scrutinising such significant amounts of money is to actually track the pound and see where it's used and see if it best meets the outcome. So I'm incredibly supportive of these initiatives. Have you sought used your office to see if there is best value in the use of these resources, or is it something you're likely to do in the future? Because from my take, this is about long-term planning. So the £80 million in the change fund for older people that is going to be spent this year, that's your short-term spending, but it's what that does this year and whether that's fed into, say, a mainstream core budget for an improved or redesigned service, say, in year 5, year 6, year 7. So have you given any thought to how you would track and follow that?
Yes, we've got a significant piece of work underway at the moment, which Angela Canning is managing, looking at the way in which the reshaping care for older people priority is being taken forward. Looking at the Change Fund is part of that, and we're due to publish that in March next year.
At the end of January.
At the end of January next year. I think it's coming to this committee after the recess. So there'll be more information in there for you to be able to investigate that particular issue. I think one of the things we're very keen to see is not just how the funding is mainstreamed, but how the successful examples that have been achieved through use of the money are spread elsewhere across Scotland to get the benefits much more widely.
I'll really look forward to that report, because I'm hopeful that the change funds will deliver real difference in the long-term planning, but until we actually see an analysis and scrutiny of it, I suppose we just don't know. But thank you very much.
Okay, Mary Scanlon and then Colin Beattie.
Thank you. I'd just like to continue with the theme, really to refer to the last diagram that Bob Doris referred to, Exhibit 13, but paragraph 67, where you say that boards need more staff time and facilities to meet demand. So it really is about the pressure within the system, which tends to run throughout the report. First of all, Exhibit 13, I was quite concerned at the increase in the vacancy rate for consultants with over 1 year, 21% increase in vacancy rate and a 57% increase in nursing and midwifery vacancy rate just over 1 year. The second figure that alluded to the pressures within the system is Exhibit 14, where we have a 5-fold increase in work done in the private sector. I don't have a problem with that as long as the patient is treated within the time and given quality of treatment, but 5-fold increase within 1 year. I did hear what was said about NHS Lothian, and I would like to, I'm really looking for the trends within the system. I don't know if perhaps 80 or 90% of that could be accounted for by NHS Lothian, or if there is an underlying trend. And the third point, Convener, is just over the page at the beginning of paragraph 69, and that's the spending on agency nurses increased by 62%. Now, these three figures are all within 1 year, and if we look at particular health boards, for example, Lanarkshire increased their spending on agency nurses from 13,000 to 344,000, and Forth Valley from 14,000 to 273. So what I'm really asking from the three figures highlighted in page 31 and 32, is this just a snapshot at a period in time? Is this an indication of a trend in the NHS? And I think particularly the vacancy rates and the use of agency and bank nurses, which was actually something that we thought was going to be reduced. So it's a significant increase, and I would venture to say probably against government policy. I just wondered if these are significant pressures in the system, and I wondered, will we be able to meet targets in future? Should they continue, or are they just short term?
We think they are all early indications of the pressures within the system that we've been discussing, which are there for a whole range of reasons to do with increasing need, changing patterns of care and so on. I'll ask Gemma to come in a moment with a bit more detail about the trends that we're aware of. I'll preface that, though, by saying that certainly in relation to the vacancy figures, it is a complex picture. The number of vacancies for consultants and for nursing staff has gone up markedly across the year, as you say, but so has the number of staff in post in both of those categories. So there is a shift last year from 4,427 consultants in post to 4,531 rounding. For nursing staff, a small increase from 56,467 to 57,036. that's against the background against which we're seeing more vacancies. And there are differences in different parts of Scotland and for different specialties. There are some specialties where it's particularly difficult to recruit, not just in Scotland but across the UK and globally in some instances. Also, one general point I'd like to make about bank and agency staff. Bank nursing, we think, can be quite a good way of both meeting the needs for flexibility in hospital staffing, especially that everybody has to manage, and of bringing nurses back into the workforce who may have had a break to bring up their families or something else. Bank nursing can be very well managed to give you good flexibility with staff who do understand the NHS and the service that they're working in. Agency staff, we think, bring more problems and risks with them because they tend to be less familiar with the hospital, with the ward, with ways of working. So bank nursing in itself we wouldn't see as a problem. The rise in agency staffing or the cost of agency staff seems to us worth more attention, but it's still a relatively small amount of money against the context of the NHS as a whole.
Can I just say, Auditor-General, before we go to the other member, I did highlight this, and I quote, spending on agency nurses increased by 62% in 2012-13, because I do understand that. And if I may, Convener, the around 500 increase in staff for nursing and midwifery, if I think it's important to have an accurate record of this, but in the notes, 350 of that increase were prison service staff transferred to the NHS. So it's not new staff. These people were doing work, but their employer was the prison service as opposed to the NHS. So that does account for the majority of the increase in the nursing staff.
You're quite right, Mrs. Scanlon. I'm not trying to suggest your question's wrong, but just to put it in context.
But I felt it was important just to be accurate.
Thank you.
Thank you.
Gemma, could you pick up what we know about trends in those areas?
Certainly. These are key figures that we look for in the annual accounts each year to see what's happening with the trend. And what we saw this year was certainly for the agency staff was a reverse in the trend that we had been seeing previously, where it had been decreasing and moving, as you say, to a large increase this year. It's really too early to tell whether that is a real change in trend or just a difference for 1 year. What we'll need to see is to track these figures next year to see whether that trend has continued and whether these signs of pressure remain or whether action has been taken to enable that to change. What we do know is that actually changing the way services is delivered does take a long time to put in place, so it might well be that there's not an immediate reduction in these figures, but that hopefully the action taken now will reduce the trend in the longer term.
But these 3 points, the vacancy, the agency staff and the fivefold increase in the private sector, these are figures you would be looking at again in future in order to manage that. Can I just finally ask a question, having been a member of the Health Board in years gone by and looked at the Arbuthnot formula and the National Resource Allocation Committee, a lot of time has been spent coming up with a formula in order to fund health boards. And I'm quite surprised, after 14 years of this Parliament, really referring to paragraph 58, where you highlight that 5 health boards are not being given their NRAC allocation of funds. And if I can just quote, these NHS boards have been underfunded by a total of £515 million over that period. I think if I was one of these health boards, Fife, Forth Valley, Grampian, Lanarkshire or Lothian, I think I'd be quite concerned that a very sophisticated formula has been used in order to allocate funding, but over a period of time that they have received significantly less, in your own words, underfunded. Is it fair to ask all of them to meet their targets and break even at the end of the year when they are in fact being underfunded, according to your quotes?
It's an area we do look at closely each year for exactly the reason that your question suggests. I think it's important to say that we're talking about underfunding against the formula allocation rather than in absolute terms, but in principle, if the allocation formula is there, you would expect to see movement towards it over a period of time. We have, however, said both last year and this that there is no clearly discernible pattern between a board's financial performance and the distance that it is from the resource allocation formula. We say that in paragraph 59. Some boards who are below allocation do very well, some some seem to be struggling, and I think we'd like to explore that further in future years. It may also be a question that the committee wants to explore either with the boards themselves or with the Scottish Government.
Well, you do say there's a lack of clear plans and timescale to move towards that. Would you be looking to the Scottish Government to ensure that these boards are given their recommended allocation? This is at the end of paragraph 58. You're talking about adds uncertainty to NHS boards planning. Is that a recommendation that you would be asking the Government to look towards a timescale where they could receive the recommended allocation of funds?
I think it's entirely appropriate for the committee to explore with the government what its plans are for movement towards the formula. The point that we're trying to make there is that it adds to the uncertainty in boards' overall financial planning, and it fits within the context of a recommendation to make that stronger.
Okay, thank you. Colin Beattie and then Ken McIntosh.
Thank you, Peter. I think the first thing is to really note the good performance of the NHS and the Scottish Government in managing its finances in such a tight way in a very difficult time. Undoubtedly, there's challenges for the future, but I think every organisation is facing that at the moment. So, you know, I think it's worth noting that. Now, Scanlon, of course, took my question there, but I was going to ask another question, which is in relation to pension fund liabilities. There's mention to pension fund liabilities in relation to NHS Highland. In paragraph 84. Maybe I missed it, but I didn't see anything about pension fund liabilities in the NHS as a whole.
There is something about pension liabilities for the NHS as a whole, and I will ask Tricia to point me towards that in just a moment. The reason why we reference specifically Highland in paragraph 84 is because of the challenges thrown up by the approach taken there to health and social care integration that the auditors and the Health Board and Council have had to work through over the last 12 months. We're hoping that that will provide some useful learning as health and social care integration moves forward in future. Tricia, can you point me towards the reference more generally?
Page 30, paragraph 64, and the bullet points above that, just reiterating essentially the points that we had in last year's report about the NHS pension fund.
The challenge is that there has been a delay in the pension fund revaluation over the last couple of years. We think that may now be closer to being resolved since publication of this report. But we made the point last year and again this year that having up-to-date valuations of the liabilities is very important in terms of being able to manage the pension scheme and the contribution levels in future to manage the risks associated with that.
I've noted in other areas of the public sector that recent revaluations under the new accounting rules and also taking into account the reduced bond yields have resulted in almost 100% deficits right across the country. Presumably we can anticipate the same for the NHS.
You're certainly correct that where we have seen revaluations done, and I think we discussed this a few weeks ago in relation to college pension schemes, very small movements in the discount rate as well as the new accounting rules can have very significant impacts on the liabilities. It's why we think it's so important that a revaluation should be carried out for the NHS pension scheme and for the others affected by the Treasury's moratorium in revaluing over recent years.
Thank you. Ken McIntosh and then Colin Keir.
Thanks so much, Convener. And apologies if I slightly go over some of the ground that's been covered. Just, again, for clarity, just to make sure I'm, with the risk of asking Mr Doris to intervene again, I'm right in thinking the main conclusion here is that demand is increasing, but the overall health budget is forecast to fall in real terms. Is that right?
It's certainly true that demand is increasing for a whole range of reasons. We've tried in the first part of this report on pages 7 and 8 to put on, on pages 5 to 8 to put on the record what's happening with NHS funding because it is complex. Against a backdrop of very tight financial resources for the Scottish bloc as a whole, as a result of decisions made elsewhere, the government has made a commitment to protecting the budgets of the territorial NHS boards in real terms. And over the next 3 years, we're expecting that to be the case with a 0.6, a small but real terms increase over that period. it might be helpful to refer to the exhibits on page 8, which try to show in cash terms and real terms what's happening for the special and the territorial health boards, which show very small real terms increases for the territorial health boards, the 14 of them, over the years to 15-16, and varying decreases for the special health boards. So there's a complex picture in terms of those two types of board. There's a real terms increase for revenue spend, but a real terms decrease for capital spend. And one of the things that we hope our reports in general can do is to provide a clear and independent picture of what's happening with the movements in finances over a period of time.
No, that's helpful. There's clearly pressures within and priorities being given within the health service spend. But again, just to clarify, overall health spending is forecast to decline in real terms over the next 3 years. Is that right?
We say in paragraph 2, as clearly as we can, the overall health budget is forecast to decrease by 1.6% in real terms over the next 3 years. The revenue budget is forecast to increase by 0.6%, while the capital budget is forecast to decrease. And within that, the territorial health boards go up and the special health boards go down.
But what that means, though, whether you divide it into capital or revenue otherwise, health spending is going to fall in real terms while demand is going to increase. Is that right?
I don't think it's helpful for me to simplify it in quite those terms. The headline figure for the overall health budget is clear, an overall decrease of 1.6%. But when those figures are broken down, there are very real differences between the territorial health boards and the special health boards. Within the special health boards, I think a distinction between those that provide patient services, like NHS 24, and those that are providing support services, and a real difference between revenue and capital. People will have different interpretations of the most important feature of that. I think all I can do is replay the detail in a way which is as independently based as we can make it.
And again, at the risk of just asking you to clarify something that was commented on earlier, on Exhibit 14, it was quite striking, and this is on page 31, there's been an increase in spend on both bank agency staff and quite a dramatic increase in spending in private sector health. Does this really represent good value for money?
The increase in both of those is significant, but against a very small base. We're talking about an NHS budget of about £12 billion. And, for example, last year the increase for private healthcare provision was £14.8 million, which is a very small proportion of that. I think the government has been very clear that its approach is not to prioritise spending on private healthcare provision, but it is using that where there are particular problems, as Tricia has highlighted, in places like Lothian, in meeting wider healthcare delivery targets. The question of how that's being managed, I think, is one that's better directed towards the health boards concerned and the Scottish Government. So it's absolutely true there has been an increase, but it's from a small base and is still a small number within the context of the NHS as a whole.
Thank you. Can I just turn to something else entirely? And again, this is an issue which was brought to my attention, and I couldn't see it in these accounts, but you might be aware of it. This one particular example is in the NHS Tayside, and it was the I'm not sure if it's called the revaluation, but the handover of assets of non-profit distribution, NPDO, non-profit distribution organisation assets to the health service in this year, in 2012. There was a project in NHS Tayside, which was the Susan Carnegie Centre at Stracathro, which was a contract cost of £18.4 million, and another project, the Murray Royal Hospital site in Perth, a project cost of £77.1 million. So in other words, projects that facilities which cost £95.5 million. But when they were handed back over to NHS Tayside, they were revalued at 83.4. In other words, they lost more than £10 million. They were revalued at £10 less than their cost to build. Would that emerge somewhere in the NHS accounts, or was that something that you would audit?
We talk in the report in paragraphs 26 onwards about the accounting adjustments that are required in relation to PPP projects of various types. I think within that the Murray Royal Hospital is referred to and the Stracathro Treatment Centre isn't. Gemma's our expert on this, and I'll ask her to talk you through what the position is in broad terms, and we can provide any other information that's necessary afterwards.
The auditors, the figures themselves would appear in NHS Tayside's accounts relating to that, and it was an issue that the auditors at NHS Tayside raised in their annual audit report to the board and to the Auditor-General about that impairment on the valuation. The auditors recommended that the Health Board work with the Scottish Government to discover why that was the case, and that will be something they'll be following up as part of their audit through this year, and that we'll look at again next year to see what action has been taken and whether there are any wider issues arising rather than just at NHS Tayside.
Were you surprised to see, I mean, such a big project to lose more than 10% of its value like that? Is that something you'd expect? Is it normal practice in the NHS?
We don't have the details of it to know whether how the valuation was arrived at, and we know that the auditors looked at it and assessed it with the board, and have asked them to look into see whether there's any wider implications for other NHS boards arising from that valuation. So it's something that we'll have to follow up over the next year, that the auditors will be following up themselves.
And do we know if there are any other NDP projects or any other construction or capital projects that have similarly been revalued or asset impaired in this manner?
There are a number of PPP projects in the NHS and some new ones coming on stream now. It's something which the auditors routinely keep under review as part of their annual audit work, and will be reporting, as Gemma said, both to the Health Boards and to me as Auditor-General. If there are significant issues or a trend coming through, I'd certainly consider reporting that to this committee, but that's not been the case so far.
So if this was to develop into a trend, if there's more than a one-off, you would expect us to be alerted to it?
I would alert the committee to any significant financial issues that come out of my areas of responsibility in the NHS and the wider public sector. So far, that's not been the case.
In this particular case, then, what would be the next course? It's obviously been reported by the board. Would we expect the government to take intervene in some way to report to Parliament? Would we expect yourselves? How would this be accountable in a parliamentary manner, or would it not be?
As I say, normally if there's an issue which we think is significant enough to bring to the attention of this committee, I've got reporting powers to do so, either through the Section 22 powers to report on the annual accounts of a board, or through a Section 23 report like the one before you today.
I'd have thought that losing £12 million on a building project is worth... I would have thought in these times of tight budgets that's the sort of thing that this committee would want to know about. And
I'm not sure it's accurate to characterise it as being the loss of £12 million on a building project. I think it is the valuation of the asset and the accounting adjustments that go from that. But I'll certainly go away and have a look at what we heard from the auditors in relation to the last financial year and consider whether there's an issue there that would merit further reporting.
Could you just clarify what it does mean? If a project is built at a cost of £95 million to the public, and then it appears in our books at the cost of £83 million, is that not a loss of £12 million?
No, there are.
What is it then?
There are accounting adjustments required, and without knowing the reasons for the variation, which, as Gemma has said, are being explored between the Health Board and the Scottish Government, and the auditors will report on further. I don't want to speculate about what the underlying cause is.
I think if there are any further issues of clarification there, either the member or the committee can write to the Auditor-General, because I intend to finish this session at 10:30, so I'm going to cut that one. Is there anything else? No. Can I just clarify before I call Colin Keir, that the paragraph to which Ken Martin, or to which you referred, paragraph 26, there are still PPP projects being developed?
Public-private partnerships is the acronym that's used to refer to a whole range of privately funded projects, including the non-profit distributing model, PFI, right, and so on.
Okay, no, because it's just sometimes the impression is given that PPP was abolished, so that they are still there. Okay, thanks. Colin Keir.
Thank you, Convener. I'll leave the obvious sort of discussion about the financial pluses and minuses. I think we've had enough of that. What I was really looking for, considering the NHS Lothian have come into a number of parts of this report, and certainly in terms of the recruitment, as I understand, you've explained it quite well. I was aware that there are some specialist areas that they're struggling to recruit, but it's not just NHS Lothian, it's UK-wide, and I believe that they're having to advertise as far as the Far East and places like that to fill these positions. And given the fact that three of my colleagues have stolen most of my questions, really what I'm left with, and the notes that I was really interested in, is given the problems of NHS Lothian over the past year or two, have we found the accounting mechanisms have been improved to a state that we can feel confident about where they are going with their own financial performance?
I will ask Gemma to come in if there's anything she wants to add to this, but I think in general terms we can say that the financial statements of NHS Lothian have been audited every year, as all health boards are, and there have been some recommendations for improvements in financial management there, but nothing significant or out of the ordinary run of things across the NHS. We saw particular problems in the management of waiting times that were reported on extensively last year, and we'll be providing an update right across the NHS on that in future. But I think for NHS Lothian in particular, that recommendation to improve longer-term financial planning underpinned by strong forecasts and strong scenario planning is all the more important because of the pressures they have faced in the past. So no differences in their accounts or financial management, but a difference in the underlying pressures they're having to manage.
Are there any other weaknesses in their reporting? I feel as if I'm picking on my own health local health service here, but are there any other reporting mechanisms that you find are weak, that are coming, that haven't been addressed? I mean, given the problems they've had, I think it's important that we all feel confident in the ability of the new management regime who are at NHS Lothian to actually ensure that the problems of the past, not just with the waiting times, but to have confidence in the other reports that we could expect from NHS Lothian to be full, comprehensive and, quite frankly, trustworthy.
I think there has been a real focus within NHS Lothian on earning back that trust and confidence of the public. The annual accounts received a clean audit certificate, as all other health boards did this year. I know you're not interested only in waiting times, but I think it's fair to say that the work we're finalising now on progress against our waiting times recommendation showed that NHS Lothian has made a really strong effort to improve the information that's coming to the board to monitor that. And I think we can take that as an indication that they are responding positively to the challenges that they've had over the last few years.
Yeah. I'm going to finish this session at 10:35, so can I ask James Dornan?
Thank you, Convener. Auditor-General, I share your frustration at some of the blatant politicking going on at this meeting, but can I just take you back to the workforce figures that we were talking about earlier on? The nursing and midwifery, which was mentioned by Mary Scanlon. My partner's a nurse. There's 10 staff have just been hired in her ward, and there's meant to be more happening, coming on in the very near future. Given, I mean, this is just one personal example, do you think that these figures are a one-off or part of a trend upwards, or do you think there's any possible decline in the figures for the vacancies?
First of all, I'm sorry if anything that I've, any of my words or body language have indicated frustration with members. Clearly, I'm here to respond to questions that members may have on the work we produce. On the wider question of vacancies, as Gemma said, this is something that we do monitor very closely through the annual accounts and more widely. We work closely with the government to look at their financial monitoring and performance monitoring between the Scottish Government and health boards, and I think it's simply too soon to say what's happening there. There are indications of pressure which we think the government should take seriously, health boards should take seriously, and there's a range of ways in which they can be responded to, which do mean redesigning services and focusing on longer-term financial planning to be able to square the circle of increasing demand and very tight resources.
Can I just take you to the agency and bank staff question as well? Nobody welcomes any increase in agency staff, but again, I know that the existing nursing staff are being asked about their bank staff availability. So there seems to be clearly a push within the health service to try and use the bank staff again, and hopefully what we'll see, and do you have any indication that maybe what we'll see is, again, a decrease in the use of agency staff and hopefully more bank staff?
I've been resisting all morning the temptation to use that famous quotation from Niels Bohr, the physicist, that prediction is always hard, especially about the future. I think we simply don't know yet. Our strong view as an organisation is that bank staff are better than agency staff as a way of responding to short-term fluctuations, but they should be about short-term fluctuation, not filling gaps for the longer term. We're seeing significant work going into workforce planning. It's early days yet to see the results of that, but it is something we'll be keeping under close review, and the committee may want to explore that further with health boards or with the government.
Coffee.
Thanks very much, Convener. I want to just start off by picking up the point on accident and emergency targets that are described in pages 36 and 37. The Convener's opening remarks described significant failures, but my understanding of this information is that there are significant successes here. In that particular column, most of the health boards are meeting or are within 95% of their target for accident and emergency. And I think that's a different message compared to the significant failure message that the Convener opened with. And two of the health boards, in particularly Ayrshire, Nairn and Lanarkshire, I shudder to think what would have happened had Monklands and Ayr hospitals shut, and what those figures might have meant in this kind of report that we're getting now. Auditor-General, in your opening remarks, you talked about the need for detailed planning. Detailed planning wasn't being done on affordability of the plans, and I want to pick you up on that and what that might mean. Your report does talk, though, about brokerage and flexibility arrangements on a year-by-year basis, and I just wonder, is that mechanism, that brokerage and flexibility mechanism, one that can be deployed by the boards to ease them, to help them with this detailed planning that you talk about, or are we stuck rigidly to the annual financial planning that you yourself recommended that we should move away from? So is that flexibility one that you recommend we should continue with, and does that therefore mean that we don't need rigorous annual financial targets to be set?
At the moment, there are, as you say, very rigorous annual targets, and health boards and the government take very seriously the need to meet those, which is good in terms of financial discipline, but we think can get in the way of the longer-term financial planning that's needed to really find more sustainable solutions to the pressures the health service is under. At the moment, brokerage and other short-term flexibility is the way in which those targets are hit. To come within 0.16% of the targets across the NHS as a whole isn't done by chance. It's done by very close monitoring month by month and moving money to where it's needed. And again, that's entirely understandable within the framework that we're working in. Last year we reported that those movements weren't transparent. This year we think there's been a real improvement in boards' reports, annual reports and accounts, in making that more transparent for revenue, although we think there's still more to do in relation to capital. But we still think there's a danger, which I think is now a view shared by the Cabinet Secretary and Scottish Government, that it would be helpful to move away from the annual framework to something that gave a longer-term planning horizon. And our view is that within that horizon, the ability to respond to the pressures will be really strengthened by much more detailed financial planning and scenario plans that look at different possible states of the future, different ways of providing services and so on. This is all about marshalling the best of the NHS to make sure it can continue to meet people's needs as we all get older as a population and as our needs change. The annual financial framework seems to us, on balance, gets in the way of that flexibility, and we're pleased to hear that the government's considering ways of moving away from it to something that provides a longer-term planning framework.
I'm really encouraged with that, Auditor-General. Thank you. And because time's short, I'll move on to the next question. It was really about opportunities for recurring savings. In your chart, Exhibit 10 on page 23 there, showed that the biggest return, I think, was in the drugs and prescribing area, perhaps drugs coming off patent, and the savings that we've been making there. Is that a trend that's likely to continue, or is it likely to get worse? It seems to me that there's been some quite impressive savings there for the NHS in the last year or so, and would we expect to see that continue?
I'll ask Tricia to come in on the detail of that, but you're right that drugs have made a significant contribution, and there is something important there which we highlight in the report that boards need to be aware of. That's very much affected by specific drugs coming off patent and being available in generic forms that are much cheaper. That tends to happen in chunks, so you get a significant saving in 1 year because of drugs coming off patent, but you can't rely on the same thing happening on a regular basis. Tricia, can you just add a bit of context to that for us?
Yep. In 2012-13, atorvastatin, one of the most popular statins, came off patent. That's used by a lot of people, widely prescribed, so that's one of the drugs that has had a significant impact. There won't be the same kind of level of potential savings from other drugs coming off patent in the near future, but we are aware that there is a lot of work going on with the government and with the boards, continuing to look at improving the quality and cost effectiveness of prescribing. We know that there's a national work stream. It's looking at things like national therapeutic indicators, where they're identifying a small number of drugs and types of drugs to focus attention on in terms of improving the quality and cost effectiveness of prescribing. But we don't expect to see the same level of recurring savings as in 12-13, because so much of that was impacted by, in particular, atorvastatin.
Just to follow on that very briefly and finally, hopefully, Convener, I mean, we must know, or the system must know, which drugs are coming off patent in the next 1, 2, 3, 4, 5, 10 years or so. And is the NHS able to build that into the forecast and financial planning? Because I know previously, Convener, there was good progress made in using generic drugs rather than brand drugs, and I think that's trying to be welcome, I think. So do we build that in our forecasting, as you mentioned, Auditor-General, earlier on?
Yes, it is built in, and you're right, it's been a significant area of success for the NHS. I think the point we're making is that atorvastatin is a real one-off because of the extent to which it's used in the health service. It's hard to spot another drug where the impact of it coming off patent will be as significant for the budget.
Okay, thank you. Just before I close the proceedings, the point Molly Coffey made about my comments on accident emergency, you know, I hope I haven't misinterpreted. So possibly, Auditor-General, for the record, could you state which health boards actually met their A&E targets?
We've tried to make the exhibit as clear as we can, Convener. Excuse me. The 4 boards that are marked with a green tick all achieved 4-hour waiting times for A&E. The boards with the 2 yellow arrows came within 5%.
Just the boards that met their targets, could you just list them for the record?
I'm reluctant to interpret what's quite a complex exhibit on the record because of the degree of focus that's being placed on this number, Convener. It might be useful for us to write to you to place that on the record. You can see there's a number of indicators in that column which have quite specific meanings, and I'd like to make sure we don't mislead the committee about what they mean.
No, that would be helpful, because the table as presented indicates that Orkney, Shetland, Tayside and Western Isles met their targets. So it would be helpful if you could maybe clarify what the overall statistics mean, so that we're not under any misapprehension about the significance. So that would be useful. Thank you very much for that. Okay. So, sorry, I'm just... Auditor-General, can I thank you and your staff for the evidence, and no doubt we will follow that up at some point. Thank you very much. Yeah. We'll break for a couple of minutes just to allow a change over. If I could perhaps reconvene and go to item 3 on the agenda. Previously, we'd heard from the Auditor-General and Audit Scotland on a Section 23 report, Scotland's Colleges 2013, and I would like to welcome to the committee our first panel, Audrey Cumberford, who is the Principal and Chief Executive of West College Scotland, Margaret Monckton, who is the Acting Principal and Chief Executive of Perth College, Susan Walsh, Principal and Chief Executive of Glasgow Clyde College, Alan Williamson, Director of Finance at Edinburgh College. I'm not sure whether it is a direct interest, but I'd like to declare that my wife is a member of the board of West College, just in case there's any potential conflict of interest. Okay. Can I just ask for clarification before we get into the detail of the report? Principal and Chief Executive, that seems to be a title that's now common currency. Why not Principal, or why not Chief Executive? Why both?
If you don't mind, Convener. It's very simple. In incorporation, the emphasis was on colleges operating in a business-like fashion, and principals who had previously only had responsibility for the academic element of an institution were seen to change role, and therefore the title was changed at that time. So it's just tradition from the point of incorporation. So the Chief Executive bit was supposed to highlight the fact that we were actually responsible for the financial well-being, the well-being of our staff and our resources going forward. I think you'll actually find over time that the Chief Executive element of it diminishes.
Right, okay, that's interesting. Maybe it poses some other questions. You know, there are real challenges in the further education sector. We've heard a lot of competing and contending comments, but one of the things that we heard from Audit Scotland was that a reduction in Scottish funding, grant funding of 56 million in real terms compared to 2010-11 had contributed to colleges' overall income falling by 9%. Now, given those circumstances, so fallen 9% between 2010-11 and 2011-12, and then there was a further 11% reduction in real terms between 11-12 and going through to 14-15. Can you all say that you are able to deliver the same level of service as you previously did, the same quality of service that you previously did, and the same volume of students? Has there been any significant change to what you do? Yeah.
Absolutely, there has been an impact, but there is a difference between the level and amount of activity vis the quality of activity. So, for example, in West College Scotland, or what were the 3 constituent colleges that make up the new college, over the period that you've just mentioned, there has been a reduction of approximately, in terms of headcount, enrolments rather, 10,000 over that period. So there has been a reduction in the number of people attending the college. There has been a reduction in the provision, as in the range, the level of provision that we can provide. In terms of the quality, actually our performance indicators are increasing, and that remains an absolute key focus for West College Scotland going forward.
So there are fewer students, but for the fewer students who are attending, the quality hasn't been affected. There may be some questions I want to ask you just about. One of the things I'm not quite sure about is why particular colleges were brought together and what the significance is. But I don't know whether, before I ask that, whether any of the rest of you would wish to comment, or does that apply to you as well?
Yeah, I think it probably applies across most of the sector. There are differences, obviously geographical differences that have to be taken into account. In terms of the level, we've actually expanded the level in SCQF terms to allow students to access degree programmes within one of the campuses of Glasgow Clyde College. And I think in terms of local access, that is a benefit to students. Like Audrey has alluded to, the quality has actually improved in last year. Cardonald College, now a constituent part of Glasgow Clyde, had no points for action in its latest HMIE review, and that's not a very common occurrence. And I have to praise the staff, both the teaching and the support staff, in supporting students and allowing that to happen. I think the issue around about volume is about definitions in volume. There are varying understandings of what is a full-time student and a full-time equivalent. But in terms of enrolments, which really is the number of people who walk through the doors of a college, if Glasgow Clyde College had existed in 2009, today it's got 14,700 less enrolments.
14,700 compared to the colleges which
amalgamated to form Glasgow Clyde.
Right.
And in terms of the cohort of students, the age profile has dropped, and you can track the differences in terms of percentage attendance between 16 to 19-year-olds, 19 to 24-year-olds and the 24-year-olds plus. The biggest drop is in the 25-plus area.
Can I just explore that? Because that's quite a significant age group. And if you look at some of the recent news, for example, we don't know what the future of our shipyards in Glasgow might be. And recently in Paisley, as Audrey Comerford would know, BASF have indicated that they intend to cease production. There are one or two other manufacturing companies and other companies are going out of business. Now that then means that those affected by redundancy, unless they're near retirement, need to think about reskilling and retraining. And they wouldn't necessarily fit into that 25-year or less age group. So what then is the impact for those who need to retrain or reskill because of job loss, given that you've said, Susan, that that's one of the age groups where there has been a significant impact?
I think some of the issues are around whether it's demand or need. Some of the reduction is through people choosing not to come to college, probably because as a sector we haven't had particularly positive PR in recent times. And some of that is about the focus on 16 to 19-year-olds. We welcome that. We understand that young people need an opportunity, and the earlier we can provide education for people, the more positive benefit actually comes back to their families but also to the economy. The issue has been around where we may have offered programmes previously. We might have reduced the number of times in a year that we offer that programme, or the number of opportunities that would be offered. For people who are in jobs, colleges were always a way of enhancing their qualifications whilst they remained earning. And I think perhaps some of the the instability in the economy has meant that people have chosen to stay in jobs and not focus on their education as well. There are issues around about fees. People have to pay for training. So from that perspective, I think it's about people choosing not to come. It's about us unintentionally but necessarily limiting some of the opportunities that are available. And when you look at specific things like BAE, obviously my college is very much involved with BAE, we need to look at how we work in partnership with other organisations such as SDS, through the PACE programme perhaps, that actually helps people deal with potential redundancy situations. And I think it's the flexibility in funding that would allow us to do that.
Can I just ask that about that issue you mentioned on people improving their qualifications while they are working in a previous experience? I was a teacher, and while I was teaching I was also a lecturer at one of the Glasgow colleges in the evening. Do those and the people who attended those classes were all people who were in full-time employment, who wanted to add to their skills and their qualifications. Are those type of classes affected?
I think, I'll certainly speak for my own college. We have seen a reduction in the number of classes that are offered in terms of evenings. At one point you would have found a local FE college might have been open 4 or 5 evenings a week. I think
simply as part of our response to the budget cuts that we have looked at trying to concentrate the facility use, and that has actually led to a reduction in access in the evenings. So it does make it harder for people who are actually in full-time employment to go and upskill.
Okay.
I think there's no doubt the profile of the portfolio of colleges has shifted, one in response to the cuts, but also Scottish Government priorities. And I think that's something that colleges are good at, is actually responding to what the Scottish Government of the day's priorities are. But there has been a shift to full-time education at the expense of part-time education.
Okay. Mary Scanlon.
Thank you. Like you, I'm also a relic, if you like, of further education. I lectured there before coming here, and delighted to see 3 female principals here today. I've just got 3 short questions I'd like to ask. Referring to the report, page 18 and 19, the teaching budget has fallen by 69 million over 2 years. 48,000 less students, 16% fall. That's paragraph 32. And part-time students fallen by 40%. So I would really like to relate this. I think it's tragic if mature students aren't finding access, but I would really like to refer to Scottish Government policy, which we all support, and that is the Wood Report. Now, given all the cuts, given the reduction in courses available, given that the age profile has dropped, given you've said limiting opportunities, etc., if the Wood Report, the final report, which we expect at the end of the year, if that is to work, how can the colleges, or will the colleges be able to respond to the need for vocational education for, I think it's over 14-year-olds, will you be able to meet the challenges set in the Wood Report, given the serious cutbacks in provision and headcount and finances in recent years?
The answer to that is yes, we can respond, and colleges have to play a key role in responding to the Wood Report. There is a but. And the but is that our resources are our current resources. Therefore, if we were looking at putting in additional activity in response to the Wood Report, then that resource has to come from somewhere. So either that has to replace activity that is currently underway, assuming that we are all delivering to our maximum capacity and activity, which we are. So it either has to be replaced, or it has to be additional resource that comes into the sector to facilitate that. But absolutely, there is a willingness in the college sector to very much respond, and is already responding and actually delivering many of the recommendations that are coming out of the interim report.
We also see that we can do a very effective job in replacing some of the existing provision that we already deliver under the school-college partnership. We want to strengthen the senior phase curriculum, and we want to enhance what the increased number of school pupils are doing, particularly in their 6th year at school, by enhancing that range of provision. So some of that displacement that Audrey's talked about can be done within existing arrangements for school-college partnership, but we do rely on the schools to meet us and to work to that same end. The more delivery that we do in the senior phase, it will have a negative impact on the utilisation of school staff. So that's us just being realistic about that. On the tack of modern apprenticeships, we do bid for additional funding on an annual basis through the SDS mechanism, and in that respect, that fund is drastically oversubscribed every year, and it would be a bonus to us in Scotland if a more strategic approach was taken to the allocation of that funding in line with government priorities.
So are you In terms of modern apprenticeships, and can I just say I was at Inverness College on Friday to see the school pupils in, and that is a wonderful, wonderful model, which I have to say every party in this chamber supports. But are you saying that the SDS funding is limiting what you can do in modern apprenticeships? Because bearing in mind that 77,000 youngsters are still not in education, employment or training, are you saying the budget is limiting what can be done?
Absolutely, it is limiting. The bid process on an annual basis is oversubscribed every year. We as a college at Perth have been denied for the second year running any funding for hospitality students, and tourism is a priority, a government priority, and in particular a priority for Perth and Kinross.
Yes, well, I'm sorry to hear that. I realise my colleagues all want to come in here, so I'll just briefly ask the second question, which I think is probably for you, Margaret Monckton. And I represent the Highlands and Islands, and it's a different model, obviously, to the mergers and regionalisation. I am concerned of what is often referred to locally as the top slicing of the budget by UHI before it comes to colleges. And I am concerned that you are perhaps being asked to do more with less funds in terms of teaching. I appreciate the quality is still excellent, but because you will not have the economies of scale from the mergers, etc., you won't be able to achieve these savings. The 15 million that it costs to run the UHI administration and the 200 staff, does that put the colleges in the Highlands and Islands at a financial disadvantage compared to other colleges in terms of what you can use per student?
I'm not sure about the comparison between Highlands and Islands colleges and the rest of Scotland in terms of a per capita resource, because we're funded on a different basis for our HE funding. So it's not easy to draw that direct comparison. However, it's fair to say that any amount of top slice reduces the money that's available for the frontline delivery. Of recent years, I would say, since the university achieved growth targets, we have been able to increase slightly the unit of resource that comes to the colleges to pay for learning and teaching. That's not to say that the size of the central administrative office is acceptable and is still growing. It was the subject of a Scottish Funding Council report by Capita, so we refer to it as the Capita report, and that gave very clear recommendations, and progress against those recommendations has not been as rapid as what any of the partners would want to have seen.
That report came out 2 years ago. Can I just, convener, say that even if you were receiving the same funding per student, as Tavish Scott would also know, the critical mass that your colleagues on either side of you enjoy in terms of numbers, we don't have that in the Highlands, and quite often the class numbers are smaller, but it would be a sad day if these courses were to leave, so we'll perhaps pursue that later.
On recent analysis of data as part of our regionalisation, and the class sizes across the Highlands and Islands region for further education vary from 9, which is, I believe, in Orkney, to 28, which is in Perth.
Can I just go on to my third question? And I've met various college principals, etc., lately, but there does seem to be something. It's actually part 3 of the report, and for colleagues, I would refer to paragraphs 67, 68, and 69, and that is the reclassification of colleges. And Mr Williamson, it may be an opportunity for you to come in. But I am, we've just heard the Auditor-General saying that she wants to get away from balancing the budget every year in the NHS. And now in colleges, we're finding that you're going to have to balance your budget every year. In my opinion, it seems to stifle your ability to use funds. Susan Walsh, you said at the beginning, colleges have behaved in a business-like fashion, which they have done since the 90s. Do you feel that the ONS report and the reclassification is a loss of autonomy? Do you feel becoming a government department is something that would help to grow the colleges? I just wonder why you're being treated different to universities, why you're not being allowed to build up reserves. You won't be able to do any commercial work, and basically your financial year changes, I understand, from the student year, which has always been the way, to the fiscal year. So perhaps how you're going to cope with this reclassification into a government department rather than being what we've always seen as autonomous bodies which have been able to react and respond to local economic pressures.
I think across the sector most would have preferred the ONS reclassification not coming in. As
England, legislation was brought forward to stop it affecting colleges like this, but that wasn't done in Scotland.
Yeah, because it tends to limit the use of surpluses and similarly the use of any reserves that you might have. However, it has happened, or about to happen, and we are looking at mitigating arrangements and working as best we can through the imminent changes coming up.
I understand that you're going down the road of setting up arm's length trust organisations in order to overcome this. Am I correct, or would you like to perhaps expand on that, how that's going to happen?
Well, there were two options. The Funding Council offered to set up an umbrella trust in which most of the colleges, if they wanted to, could join it. However, some of the boards within the colleges decided that they would prefer to set up their own trust, as it might give them maybe an element more flexibility in what they can do. Of course, the key criteria for setting up these trusts is independence and dominant influence. The independence is very much on the legal side, so you can be legally set up as an independent development trust. However, you need to also pass that through your auditors to ensure that there's no conflict on the dominant influence side, because a dominant influence side would mean that you have to then consolidate the accounts of both organisations, and therefore any surpluses or reserves will be captured in the same way as it would be under the ONS reclassification.
So could I perhaps ask the principals about how confident are you about the flexibility or lack, or will you be able to continue as you have done in the past? Do you feel this new concept will stifle what you're doing? And can I also ask how it would change any colleges that currently have loans from banks, etc., how it changes your, or even PFI projects, how does this reclassification change that? Is it a cause of concern?
Well, in West College, Scotland, currently 21% of our income comes from other sources, and that income absolutely in terms of is critical in terms of strategic reinvestment into doing what we do and enhancing the provision, our resources, our estates. And to take that strategic perspective, that's where the challenge is with ONS and moving to an annual cycle. It is fair to say there are still some unknowns in relation to colleges are either pursuing their own regional solution via arm's length foundations or moving towards the National Umbrella Trust, and working closely with lawyers and our own internal and external auditors to try and work through some of the responses to the questions that you've just asked. And it's fair to say that actually we don't have all of the answers to some of those questions.
Convener, I understand this is to be implemented on the 1st of April, so
Yes.
we're running a wee bit short of time.
Absolutely.
Can I just ask, Audrey, if I may, the 21% coming from other sources, that's commendable, but how will this reclassification affect that in terms of your college?
Well, in terms of generating reserves, and our view is that it is important to be able to generate reserves to reinvest back into the college for the benefit of our students, our local communities and our staff. And we know that the public funds that we currently receive pretty much just pay the payroll bill. So everything else we have to do by ourselves and by generating income from other sources.
So reclassification will stop you from generating income from other sources?
It won't stop you doing that, but it does mean that you would have to reinvest on an annual basis, which of course doesn't allow strategic planning and strategic investment, which is important.
But this, sorry, I'll just leave it there. I think we could go on further.
Just before I bring Tavi Scott in, can I get some clarification on these arm's length trusts, which you all seem to be exploring? Will they be completely independent? And if they are, how then do you have any accountability? To whom are they accountable? How do you have any accountability over the funding that is either transferred to or generated by these arm's length trusts? And how then do you, how do you guarantee that there is a benefit to the college from an arm's length trust over which you potentially have no control?
There is no guarantee. We are going with the work of the Funding Council, who are acting as main advisors to the sector on this. This is a need to do in order to preserve our ability to invest in our facilities and our students and our staff. So this needs to happen, else we will be a poorer sector as a result.
I understand why you're doing it. I understand that potentially you could, as you describe, Margaret, a poorer sector. I'm purely interested in the accountability and the money lines. Like, where does the money come from? To where does the money go? How is the money then used? And who then assumes responsibility? And can you clarify? Even if you go with the umbrella trust that the Scottish Funding Council is promoting, presumably for the same reasons that you described with your own possible arm's length trusts, that umbrella trust would also need to be completely independent of the Scottish Funding Council. So to whom is that accountable? And if that umbrella trust operates on a Scottish-wide basis, and there is money generated, for example, either from Perth or from West, and it goes into that trust, how do you know that the money is then coming back to be spent in your area? Can you have any control over it at all?
We have replied to the Funding Council that the single umbrella trust for Scotland is our preference at Perth. And we are relying, therefore, on that umbrella trust being set up in the way that we have been informed it will be set up. And our understanding is that it will be partitioned. So the money that we need to lodge there on an annual basis, because we have 44% of our income is generated out with the public fund. So the likelihood of us needing to put money in on an annual basis rather than being forced to spend as we generate it within the year is highly likely. So it is important, absolutely vital to us, that the money that we are thus generating comes back into us at Perth College. So we've been promised partitions so that what we put in will be preserved for the good of our locality. How long that partition will last into the future, we're not clear. We've been asked at this point to propose, as there's only 3 of us across Scotland who have currently voted to use the single umbrella trust at this point, we have been asked as a college to propose a trustee, because they need at least 3 trustees to go in the initial deed. That can be changed thereafter. So we will be proposing a trustee from our locality who is independent from the college.
If there are 3 trustees and 2 come from other areas, there would be nothing in the future to stop those 2 trustees deciding that the pressures of the west of Scotland or the south of Scotland are more significant and the money could therefore be used.
Absolutely.
Right,
We're
okay.
relying on that compartmentalisation.
A leap of faith, sorry, Susan.
Yeah.
I think you've just rehearsed the arguments that have been had in boardrooms around Scotland in the last 6 months. The issue about how do we ensure that the money which has been generated by colleges is used to benefit those particular colleges can be contained in terms of the charitable status of the arm's length foundations. And it's about very carefully defining the articles in the Constitution, so carefully defined that the money could not be used for anything else other than the benefit of students of whichever institution it is, whether that's a region or a college that sets up an arm's length trust, whether that's a Scottish charitable incorporated organisation or otherwise. And as Alan has said, it is very much about independence, but it is also about ensuring that the funds which have been generated are used for Scotland's learners.
Sorry, Alan, you wanted to come in?
I was just going to repeat really what Susan said there, actually, but by creating the arm's length trust does give you a lot more flexibility in how you as a college can operate to generate commercial income in particular and then reinvest in the college.
What then will be the charitable status of colleges in the future? What implications are there?
We understand from the Funding Council that the charitable status of incorporated colleges is unaffected by ONS.
Right, and that's a guarantee? Has it been guaranteed by the charity regulator?
We have sight of a letter from Oscar which has said that the charitable status will be unaffected.
Right, so there should be no financial implications for colleges with reference to their charitable status?
We would hope not.
But I thought you said that there had been a letter to guarantee that.
We have indeed, yes. But
so why the hesitation?
It's not hesitation so much as one of the things that we have learned as college principals is that political context changes and that we have a guarantee as at today of what our expectation can be. It might change in the future, we don't know.
That would require, presumably, either a change in the law or a change in the way that the charity regulator operates, because that should not be subject, in the first instance, to political influence.
I meant political convener in terms of the political will to change legislation that might have an effect.
Right, okay. So, Tavi Scott?
Thank you. I wondered if I could ask the witnesses about the regional boards that come out of the 13 college regions. Could you just describe for me the financial role that those regional boards will play, please?
One of the issues is that the regional boards will all be different, and I obviously can speak for Glasgow, if Henry McLeish will allow me to do that. We will have a regional strategic body in Glasgow and we'll have 3 assigned colleges. The funding will come to the regional strategic body. It will go to that body and therefore be distributed thereafter on an evidence-based basis, based on the regional strategic framework that we're developing at the moment in Glasgow. So the regional board will be the fundable body.
And therefore, what do individual colleges do to make sure they get their fair allocation out of that? Just have to fight hardest when it comes to that meeting?
Absolutely. When you use the term fighting, I would say it's more like tag team, in that the 3 colleges that now exist in Glasgow are actually part of what was historically the Glasgow Colleges Strategic Partnership anyway. So we already had an operating framework in terms of how we would work together. In some ways, the regional strategic body is simply putting in a governance layer which previously would have lain simply with the colleges themselves.
What do you think does that board therefore add to the party?
I think one of the things that it adds is the capacity to speak with one voice for Glasgow. Glasgow is the producer of the highest GDP contribution in Scotland. And it's not just the city of Glasgow, it's metropolitan Glasgow. So it allows us to actually engage with key stakeholders with one voice. And we've not had that previously.
No, I get that. That seems a fair point. You're not concerned by the potential for individual colleges to lose out, given you're not all going to get what you want in terms of the overall allocation that's given to the regional board for Glasgow. Presumably there's some concern at a lower level you'll not get everything you want.
I don't think anyone ever gets everything that they want. The issue is about we are better being interdependent than being independent in this case, simply because the way that the regional strategic framework will be built and the college plans which will allow us to actually fulfil that strategic framework, they're being built from the bottom up. So we start with economic and skills analysis, we talk to our key stakeholders, our employers, our schools, the universities. So we're actually building it. It's not that we are working in isolation and then saying, that's what I want that bit of the cake. That's not the mechanism we're developing.
That's fascinating. Can I ask Margaret Monckton, you mentioned the losing a course for hospitality at Perth College. Does that mean in the comparable structure you've got in the north, the system already has examples whereby, in your case, Perth College weren't able to gain funds for a particular specialism you wanted to pursue?
Yeah, the hospitality course, just to be clear, was modern apprenticeship funding, which flowed through SDS. The situation about the regional strategic body is very different in the Highlands and Islands region. That regional strategic body is proposed as being the University Court. So the University Court will thus have the flow of funds for FE throughout the Highlands and Islands region, as well as the funds for HE. So we have well-established principles and a committee structure to ensure the distribution of HE, but there's no great competition for that. The converse is the situation in FE. The envelope is not big enough. So it will be a slightly different situation when we come to adjust through the regional strategic body. There has been concern that the top slicing that was referred to earlier is enacted on the FE flow of funds, and we have reassurances that that will not happen. However, our FE regional board, if you like, is a committee of court. Our regional lead will not be appointed, we believe, through public appointments. So our regional chair will not go through the public appointment process, because there is certain anxieties being expressed about public appointments being used to appoint the chair of a committee of the university. And I can see that argument. However, it is not a committee of court at this moment in time. So that is something that is exercising us at present, is the appointment of that regional chair, who will become a member of court also.
Who will make the appointment? If it's not going to be done through the public appointment system, who makes the appointment? It
would be the court themselves, who are at this current moment in time being reformed.
Right. So given the differences, you would presumably prefer that to go through a process presumably that's similar in Glasgow or in other parts of the country?
I think in governance terms that would be a lot more transparent and open.
Okay. Thank you. And then just on the principle of the system that you're about to be part of in terms of the UHI, do you think that'll... I take the point about the cake and the size of the cake and so on and so forth. How do you think that's going to work in terms of all of you getting around the table, presumably once a year, to sort out the allocations to individual further education institutions?
The direction of travel that we see is that the smaller colleges in the more rural locations want to offer a wider range of provision, and we understand that. The way we've done that at HE is to use networking delivery, so we can combine delivery at a distance. We don't feel that that's appropriate for the maturity of the learners, not their age, but their maturity as learners for FE students. So we are going to, if we want to support as a regional board or a committee of court, if we want to support more activity being nested in the remote areas, we're going to need to sacrifice larger class groups in the urban areas. So a class size of 28 at Perth could be sacrificed for a class size of 9 in Orkney.
And
that's the reality.
Yeah, those are the dilemmas you'll have as a yeah. Thank you. Can I just ask about Edinburgh's situation as well? Is it in terms of the regional board? Is it as we've heard from Glasgow? Is that how you see the structure working in here in the east?
Well, our regional board is kind of formed anyway, and when you were touching on the financial side of it, the financial strategy is agreed by the board. And therefore we have a good idea exactly of what we are going to be planning for, and hopefully what we're going to be achieving in future years through that approach.
Mm-hmm. Okay, so your pitch, therefore, I guess this applies to all, will be to the Funding Council for funds based on the assessment you make, the strategic plan that was mentioned earlier on.
Well, it will be, yeah. Although the outcome agreements, of course, tie into that as well, where the Funding Council have their guidance from the government on what we should be focusing on through the outcome agreement to make it much more joined up.
And therefore, the flip of that argument, the flip side of that argument is how much discretion do local colleges have to answer local economic needs in respect of skills needs, skills training? Is there still going to be room to make that argument through the structure that comes to regional board and therefore becomes to part of your overall strategic plan for your region?
Well, we certainly identify where the needs are within the local community, and that information is fed into the Funding Council, and that should form part of the outcome agreement.
So it's not a straitjacket, there's flexibility.
There is flexibility within.
Yeah, okay.
The outcome agreements are aligned to the single outcome agreements in relation to the community planning partnerships. So there has to be an alignment with local colleges in relation to their local authority, CPP areas, as well as the national outcomes.
Good, thank you.
Colin Beattie.
Thank you, Mayor. The Attorney-General's report on colleges, recent report, mentioned in paragraphs 19 onwards about pension deficits. And the pension deficit, which has been mentioned here, is £115 million, which is obviously grown over the years, and there seems to be no indication that it's going to do anything else but continue to grow. Now, I also understand that this only covers the local government pension scheme, not the teachers who are in the Scottish Teachers Superannuation Scheme. So how are colleges viewing this? I mean, it's a lot of money, and presumably at some time somebody's going to have to cover it.
I could comment on Edinburgh College. Last year we had around about 11.5 million as a deficit, and this year we're down to about just under 9 million. So there has been a positive movement, mainly because the economy has picked up and the value of your assets has improved over that period of time. Within the valuations, there's quite a number of assumptions that are used by the valuers. One of those where you do have a degree of flexibility is on the pay assumption. At the moment, they tend to use the local authority pay assumption, where it's built in with incremental scales in regular pay awards. Whereas certainly within the college sector in Edinburgh College, we haven't had any pay award for probably 2-3 years now, although this year it's around about 1%. So therefore you can actually get a more accurate reflection through that. However, you are limited to the value of the liabilities that are put on, people leaving the scheme as well, where you're carrying that liability, and of course new members joining the scheme who are paying or contributing at a lower level. Overall, how does it affect the college? Really depending on the size of the deficit, it's predominantly through the contribution side. So in future, if your deficit keeps rising, then there's every likelihood that the contributions that the organisations pay will be increased.
And those contributions have been increasing. Also, the teacher scheme, Alan can help me out here, but the teacher scheme is on a different basis. And there is no fund as such. What is received in is paid out. So in accounting terms, that has a different status. So it isn't avoiding the issue of the teachers' pension scheme. It just is run on a different basis from the local government scheme.
One of the comments made by the Attorney-General was to the effect that there are a number of different contribution rates even within the same pension scheme. Maybe it's not explored really at any depth in the Attorney-General's report. The Auditor-General-for-Scotland report. maybe you could give a little bit more information on that as to how that works.
When in Edinburgh, when there were 3 colleges, we did all pay separate contribution rates, ranged from 17 to 20%. And the contribution rates are really based on the age of the staff and the number of staff that you have, and the likelihood of when you're going to be paying that contribution or in a pension benefits.
Because I think, Margaret, you had said earlier on that the contribution rates were increasing. Does that also apply to the individual participant, or is that just for the employer?
No, it has been for the participants also.
What kind of scale of increase has it been?
I'm not sure, because I'm not in the local government scheme personally.
Well, either, does the same pertain to the teacher scheme, or is it just the local authority one?
It's proposed to go up for the teacher scheme. I don't think it has gone up of recent.
Sorry,
but the local government scheme has definitely increased.
Just on the personal side, mine probably over the last 3 years has gone up from around about 6% to 9%.
Sorry, Colin.
Given the size of the deficit, obviously it's a worry. I mean, you're not alone in this, because right across the UK, changes in accounting and changes in bond yields and so on have resulted in deficits straight across. What would trigger, for yourselves, what would trigger a decision to have to put significant sums into that?
It will only crystallise on retirement. So if, provided you are an ongoing business, you will always have people starting in the pension scheme and people leaving. So I suppose it is having faith in that demographic, that you will always have a timeline of leavers, and you won't have an absolute hit of mass leavers.
What would happen, for example, you've got 115 million now, supposing it went up to 250 million, at what point would you be concerned?
It is that it tends to be in response to actuarial valuations on the pension scheme, which I'm sure Alan will be most distressed when I say I tend to think of accountants as some kind of black art. And it does change. Alan alluded to the fact that their pension deficit improved by £2 million last year, as did Glasgow Clyde Colleges. We didn't do anything different. So the value of the pensions going up and down can contribute to that variability. And Margaret's comment about the crystallisation issue is very well made. The other issue is that colleges have to be going concerns. And in some ways this question actually relates back to the issues round about ONS and funding. You cannot tease out one distinct strand. They are all interrelated. And it's our ability to manage the funds that we are given and to generate additional income that allows us to not necessarily sleep particularly well in reference to such a huge pensions deficit, but to sleep, because we understand that our colleges are strong and ongoing concerns.
Mentions made in the Auditor-General's report of only 2 pension schemes. Are they the only 2 pension schemes? Are there any closed pension schemes? Which obviously would have a different...
There's only 2 pension schemes in the college site. That's for the teachers and support staff. At the moment, one's a defined benefit, which is the one we're reporting where we're showing the deficit, and the other one's a contribution scheme, where it's off balance sheet, and it's really just noted in the narrative of the accounts.
Could I just clarify? You mentioned that retirement was one of the issues. If my memory serves me right, there was a significant expansion of the public sector in the late 1970s and into the early 1980s. Does that then mean that there will be a bulge of people, some of whom may well already have chosen to take early retirement, but others who are now approaching retirement, and that will be a significant bulge that otherwise wouldn't be there?
I'm not sure about the national demographic on that, but I'm sure the answer could be researched. However, I think the pension strain that the colleges suffer as a result of anyone who is in a local government pension scheme, so that's all our support staff and a lot of our management staff, when they take severance or early retirement, if they're over 50, there is a significant pension strain that the colleges have to pay.
Has that been quantified, the impact of the early retirements?
I'm not aware that it has been quantified.
And
it may have.
Well, surely that's something that should be done. If you're saying it's a significant strain, then surely you should know how much that strain is.
Respond to that. It's not been done on a sectoral basis, but individual colleges collect that information. We lost 154 staff last year. That was from the 3 colleges that formed Glasgow Clyde College. That cost us something in the region of £4.8 million. And we then had a further £770,000 in strain costs. And that will have been repeated elsewhere in the sector.
Okay. Thanks for that. Bob Doris and then Colin Keir.
Thanks very much, Convener. Let's maybe start off by congratulating the colleges and how you've managed a difficult period of change and transition. It is worth putting on the record that there was a 9% reduction in budgets, and it was dealt with by reducing headcount, mainly of teaching staff. And that was a political choice, and this is where you've quite clearly managed that and managed it well. Currently in a period of modest rising budgets, but I put on record it's from a much reduced baseline. But it's in relation to how you're now dealing with the current baseline that I would like to ask some questions around. We've heard much talk, understandably, about headcount of those involved in courses reducing, and we've heard talk of full-time equivalents remaining the same. The figure I have is roughly 119,000 full-time equivalent courses across Scotland. I'm interested to know, in relation to how you map out applications to each of your colleges for these courses, because one of the recommendations within the Scotland's Colleges report from the Auditor-General was that the colleges should implement the Scottish Government's recommendations to improve the application process to help monitor the demand for college places. How's progress going in relation to that? So, for example, in Glasgow, I'll use the old college names rather than the new ones. If someone applies to North Glasgow College, Stowe and John Wheatley for very similar courses, that would count 3 individual applications, but it's one person, and that one person may very well get a college place, but as an accounting procedure it looks as if 2 people have been unsuccessful. So it's undeliberate, but it's a false picture of where we are in terms of demand. So how are colleges getting along with that? I think quite a key recommendation.
Please. Yeah. I think that colleges have always recognised that not only do you have one person applying to 3 colleges, they will apply for maybe 3 or 4 courses in each of those colleges. So it's actually magnified. When we were in a position of growth throughout the 90s and the sort of early 2000s, that wasn't particularly of concern, because if someone applied and we thought, there is always a term, that we felt people had a reasonable chance of success. And that's why college education is so important, because there is that reasonable chance of success criteria. And we had the student funding to allow them. We ran courses, and that's where the college sector grew. We now find ourselves with an MIS system that doesn't necessarily meet the needs of the new regime that we find ourselves operating in. And certainly within Glasgow, one of the things we're looking at is, do we have a common Glasgow application process? But I would like to separate applications from admissions. Applications to university are handled through UCAS. You have a highly motivated, highly skilled and very literate population that are applying. The people who come to colleges are very different. We have people who have literacy problems, we have people with personal difficulties, we've got real high flyers, and we also have graduates who come back into the college sector because they want vocational education. So it's not necessarily right that an IT solution would be what is needed. But what we do have to look at is how do we suck the data out of colleges' applications systems as they stand by some kind of platform that would sit above it, that would then allow us to say we've got 300 people, because it's people that are important, who've applied for 56 different courses, and that way the information can be interrogated properly and give your committee as well as others the information that they're looking for, and it would be much more accurate.
Can I just, I mean, with that was quite a lot of detail and I appreciate that, but I suppose what I just want to sense is whether that is work in progress across the board, across the college sector, to look at some kind of common application register to audit this effectively, but not in a way which dissuades people from vulnerable backgrounds from applying for college in the first place. Is that ongoing?
I actually have to say I've got a particular worry that this whole debate about what counts as a number of students, head counts, how big are our waiting lists, is almost a distraction actually, and has the potential to drive us in the direction of coming up with national IT solutions to what is actually very much a local response. And absolutely, should individuals have the flexibility to apply for 3 or more courses in my college, or apply to my college and Susan's college? Absolutely, because that's the nature of those students. And if you start going down this kind of numbers game, is that if a student applies to my college and wants to do, on paper, 3 courses, that's because actually in more cases than not, they don't know what they want to do. And that's part of where a college actually differs, is that we put resource into that frontline service to actually help those individuals decide what is the best course, or in fact sometimes what is the best college for them to attend. Therefore you need that local, or in our case now, regional perspective. And I do have a concern that if we just become completely driven by national and counting numbers and demand. And if I can just finish off on my high horse here, is that, if I can just use Renfrewshire as an example, and Clydebank and Inverclyde have very similar demographics and unemployment, youth unemployment levels, is that we have approximately 1,500 young people who are not in school, not in education, and not in work. Now, for me, that is the unmet demand. Forget how many people are applying to my college. That's the unmet demand in Renfrewshire. It's replicated in Inverclyde. It's represented in Clydebank. And the responsibility we have as a college, working with our partners through the CPPs, is to address that problem and not get bogged down on whether we have an IT system that can tell somebody somewhere that this person has applied for 1 or more courses.
Now, I have to say I didn't suggest a solution to how you map out...
The rant wasn't at you, actually.
No, I have to say I've had enough of scrutinising IT systems at the Audit Committee to last me a lifetime, probably, so let's not go there just now. But I just wonder if Ms Cumberford would acknowledge, I acknowledge the comments you've made, but would you acknowledge that in terms of planning on a regional basis, that it's important to know, to get a proper and accurate picture of how many students are applying for courses and whether they're applying across a range of colleges, because somewhere within that answer, I don't think you mentioned whether you thought that was important to do that mapping exercise to do some forward planning, because I'm not sure how colleges can do forward planning without having that picture.
We look across trends and conversion rates from application to offers made to people who actually turn up on the day, because actually the demand that's exerted is often articulated when people physically turn up on the day, and any extrapolation of data will not inform you absolutely on that, but you can use trends of conversion rates in the past. You get a lot of information from speaking to the student themselves, because I know that we are starting to put a likelihood score on applicants, because often if you are talking to the applicant themselves, they will say, but I've applied to so-and-so and I've applied to so-and-so. So it's that giving advice. Then you can, although although all the MIS systems are recording that application, you can actually filter that and say the likelihood is they will not turn up here. But that's about people intervention and people talking to individual applicants.
I had one final question, and I just to stress that the reason I'm asking this is it's a key recommendation from the Auditor-General, and I think most people would think that better mapping demand and course provision would be a good thing, and that's why I'm asking it. My final question, and apologies that it's time constraints that our witnesses are not getting back in to continue that discussion. I mentioned full-time equivalents, and I'm not going to get into the political discussion about the government saying we've maintained full-time equivalent numbers and opposition saying but headcount's down. Park that all to one side. There's a secure financial footing for Scotland's colleges because of the decisions, the tough decisions that you've taken, and you're in a secure financial footing in terms of future capacity, which is another key recommendation within the Auditor-General's report. Should a political decision be taken to further prioritise older students, to further prioritise certain key groups? Are you in modern apprenticeships was mentioned, although I have to say to Ms Monckton that I think different parts of Scotland will argue over who should be getting those 25,000 apprentices, but that's another thing altogether. Is some forward planning going in Scotland's colleges to say, well, if we were to expand to where the unmet need is, how we would go about that to up the capacity again, should that decision be taken?
Within that is something that colleges do all the time. I mean, we have never, I think probably from 2002 to 2005 was the most stable financial period that colleges had. And within that, we demonstrated that we could, rise and fall demand depending on what was required. Going forward, we absolutely have got processes that would allow us to identify areas where growth would be appropriate, and we've shown that we can respond to that. Where you have new organisations opening up, I'll give you an example. In Glasgow, the largest hospital complex in Europe is being built, and the local colleges, including colleges in the West and in Glasgow, have been working hand in glove with the Health Board to make sure that the employees that new institution will need will be there when it's fully functional, and that includes estates, catering, science, lab technicians, everything, and even a new nursing, para-nursing qualification. So we've got the ability to make change and to respond. The difficulty at the moment is that we just don't have the funds to allow us to meet all of the demands that people are making of us.
I need to move on because we are running out of time. Ken McIntosh and then Colin Keir.
Sure, thanks. Just a related subject. Clearly, you're struggling with reduced budgets, and you've lost a lot of staff in the last year. Can I ask if you're looking to lose staff again in the forthcoming year?
Yes.
On a similar scale, I think you lost 1,200 staff in 1 year across the board. Is it a similar scale, slightly less, slightly more?
I can only speak for my own college, and we would expect to lose some staff, but nothing like the scale of the last 2 or 3 years.
Similarly for the West.
And in terms of the headcount, I think as Mary Scanlon pointed out, it was down 48,000 in 1 year. Will the headcount be reduced further? This is the student headcount, sorry.
I think that's actually quite a difficult question to answer, simply because we also have a changing funding methodology ahead of us. And there are some key decisions that have to be made in there that will then allow us to work out what's going to be a full-time student in the future. And what will be the value of it's going to be a weighted credit in the future. Therefore, we can't answer that at the moment, but there are key issues that the Scottish Funding Council needs to answer very, very quickly in order for us to actually plan properly.
You're going to get less money per student, effectively?
Well, not necessarily. We don't know. The issue about what will be the value of a weighted credit, how many weighted credits make a full-time course, we don't know what that would be. We know what it might roughly be, but roughly is a huge variance in an FE budget. That is, it doesn't give us any comfort or capacity to plan in detail.
And I'm just conscious that the SFC are coming to give evidence after you. That's all. So what would you like them to tell you?
They have to tell us First of all, we need absolute clarity in terms of the weighted credit. We need clarity in terms of what will be considered a full-time student, so how many weighted credits make up a full-time student. We need to have much more clarity around about the needs-based element of it. We are obviously concerned that some of the figures that we've heard in terms of supporting ELS students is going to be not necessarily capped, but at the moment what happens is that colleges respond to students as they come forward with special needs. That probably will be limited in the future. And we also have to look at the deprivation funding, because we understand that that's probably going to be of a lesser scale than some of the other funds.
I think that there's a key word for me, which is stability, is that the stability, albeit fairly minor, compared to what we've just gone through for this year's funding and what we know of for next year's funding, is welcomed. However, margins continue to be extremely tight. If I can give you an example, in the West, on a turnover of over £50 million, we are forecasting a surplus of £50,000. I've used the analogy, it's a bit like trying to land a 747 on a postage stamp. Therefore, it doesn't take much to swing it to the negative, and the scenario that Susan's just mentioned there in terms of the certainty around the funding and how that will look going forward is key, and has the potential to continue to stabilise or destabilise the situation.
Just picking up on the point about development education courses for those with additional needs, an awful lot of courses, between a third and a half, I think, of all courses were lost in the initial round of funding cuts. Are you suggesting that there could be further cuts to this vulnerable sector?
The fund that I was actually referring to is extended learning support, and that's for students who are on mainstream programmes but have additional needs. They may be dyslexic, dysgraphic, whatever it is. And at the moment, they go through an assessment process, and we put together a package that allows them to remain in college and be successful. And that's done on an individual basis. And we then draw down, they simply gather weighted sums, and we draw that funding down to allow that provision to continue. Our understanding is that that might not be viable going forward from the Funding Council's perspective, and that ELS, Extended Learning Support, which has been growing year on year, may well be not necessarily capped but limited in some way. We have real concerns with that, because as students and their parents and their employers become clearer about what kind of help and support is needed in order for them to be successful, there are greater expectations, and therefore there is a greater demand in terms of ELS.
Can I just ask as well, perhaps Ms Monkton as well, are you expecting to either increase class sizes or reduce the amount of hours that students spend in front of lecturers and other staff?
We have at Perth College resisted the removal of learning hours. We do have capacity to do so, because the current funding system allows us to claim a tariff-weighted sum and deliver slightly less than that. And we are determined to deliver what is appropriate. That is having an impact financially, because we could deliver less and get the same money under the existing rules, although, as Susan says, those rules are about to change. But the increase in class size is absolutely key to us balancing the books. We now are using lecture theatres to deliver theory to 100 students at a time, and then giving them, splitting them into groups of 20 for practical. When you get into a workshop situation, we've got all sorts of considerations about the health and safety of having one lecturer to more than 16, 17 students in a workshop situation. So there are health and safety limits that we will not go over, but where we can disaggregate the delivery of theory to the delivery of practical, we are doing our level best to increase that average class size, and not at the expense of quality, because we're keeping an eye and listening to the students about the quality of their experience as that experience is happening.
Last question.
Okay, just ask, is that the situation in the other colleges in terms of the amount of hours the students get with their staff, with your staff, and the size of the classes?
There's definitely a benefit in terms of full-time courses at the moment, but the sort of resource, the extra resource that full-time students attract that we're going to lose in the new funding methodology, you know, that's what we use to support students and to maintain, you know, other facilities and services for them. It is about increasing class sizes, but only to a point where, you know, they are manageable. We're very much aware of the fact that staff have worked incredibly hard. You very kindly said, you know, we've managed these difficult situations. It's the staff that have actually dealt with, you know, increasing class sizes. We've looked at new learning methodologies, the use of IT, and as Margaret has said, you know, there's a distinction between practical skills and theoretical knowledge. So I think we would probably all have done the same thing.
It's the same at Edinburgh.
Okay, thank you. Colleague here in Millie Coffey.
Okay, thank you, Convener. Good morning to you. Question really, one and two would be, given the process you've gone through, and it's a little bit early to tell in any of the reports as far as I can see, you know, how painful it's been or how difficult, whatever you want to call it. What's been the most awkward thing in terms of arranging the management from these colleges merging into a regional entity? And how flexible is the management structure that it's able, come future years, to actually respond very quickly to the local requirements? And given the, I'm pretty sure you've answered some of that before, but particularly in terms of certainly future financial projections, shall we say, about public expenditure over the next number of years, which isn't going to be easy. We all realise that everybody would like more money and whatever. How are you going to manage the possible very difficult decisions if this period of austerity is carried on over, say, another 7, 8, 9 years?
I'll maybe start with the first bit. The biggest challenge for us, we thought, was really actually dealing with funding cuts, having a short space of time in which to restructure, to integrate your systems, and actually keep staff motivated when they were going to be applying for jobs, because at the senior level and obviously management level, you're moving from 3 to 1, whereas is one of the benefits, I think, of the regionalisation, where the resource is less. And actually trying to keep your budgets mainly in a reasonably break-even or positive position as you go through that period. I suppose the positive side of the regionalisation as well, when we talk about systems integration, it does help with the provision of information. Where previously, if you took the 3 colleges in Edinburgh before they merged, we were running off 3 different systems. They had different working practices, even for finance, would you believe? There were different stages of automation as well. And actually pulling all that together is quite hard. The benefits going forward is that should, in theory, once it's actually bedded in, should produce some economies and efficiencies as people get on top of things, as you implement these new working procedures. And where we have had to top up with temporary staff to help us through this transitional phase, the temporary staff will then move on, and therefore we will come to a lower cost base as a result of that.
It's also fair to say that the teaching staff, the statistics on the loss of our teaching staff will include many managers, because it's people on teaching terms and conditions, which include a lot of our middle managers and senior managers. So the statistics of 1,200 teaching staff, certainly at Perth, a high proportion of our losses to date have been from middle management up to senior management level.
I think. Anything else?
No,
right, thanks, Willie.
Thanks very much, Convener. I was delighted to attend at the weekend the graduation ceremony at Ayrshire College in Kilmarnock campus, and the atmosphere and excitement there was incredible. If that's reflected in any way throughout the rest of the college sector in Scotland, then I think we're we're looking forward to exciting times ahead. The Auditor-General in her report to us did say, and I'll quote here, the overall financial standing of the college sector continued to be generally sound. And she also mentioned in her report that the colleges are sitting on some £214 million worth of surpluses. And I think maybe my question is aimed at Mrs Monckton, because you mentioned that you weren't able to fund a particular course. Having a quick look at the Auditor-General's report there, your college has £5 million worth of surpluses. So our question is really, that money is public money, it's public purse. Are you able, or did you consider using a portion of that money to fund that particular course? And if not, why not?
We certainly do fund courses. We fund loss leading courses. We do all sorts of things because it's the right thing to do. It doesn't make financial sense to do so. So I'm convinced that we will take the right decision for the region, for the communities and for our students. However, that £5 million is not sitting in a bank account. That £5 million, I wish it was, we'd be getting 0% return on it. And therein lies the truth. We generate quite a bit, as I said, 44% of non-public funding every year. We will not spend that haphazardly. We have an estates development plan. We get very little through the capital funding route. We haven't had a lot of the capital funding that other colleges have. We've got a 70s building full of asbestos. We have flat roofs. So we have an ongoing repairs and maintenance plan. We also have an ambitious estates development plan for the benefit of our communities and our students. We are not able, we don't want to rely on loans, where we certainly will be worse off and restricted in terms of covenants, etc., that are requested. So we were building up those reserves, which are certainly not £5 million. And I know that Alan's got some detailed information from Edinburgh that will illuminate the situation. That is not cash to spend. That is an accounting reserve, which is totally different from cash to spend. We have commitments in advance to develop more of our buildings for student residencies, for enhancement of the student experience, for the renewal and the ongoing renewal of plant and equipment, so that our students are learning using the latest computer technology and equipment technology. So that investment burden is what those reserves are addressing. It's not sitting in a bank waiting for a rainy day. But Alan can give you some more detail behind that.
Yeah, okay. I could probably give you a good example of the Edinburgh College situation, where they were saying on the cash and cash equivalents, the actual Audit Scotland report was probably unhelpful because it gave the impression that the colleges were sitting with lots of cash. But if we take the Edinburgh College situation, you could say on a cash and cash equivalent basis, we are sitting with 30 million. Okay. However, we had an outstanding bank loan to pay off as a result of the merger because of the banking covenants we had in place. That was about 7 million. We had proposals for a development at the Sight Hill campus, which was 5 million. So that's 12 million already coming off that 30 million. Leaves 18 million of current liabilities. The short-term creditors will have to pay within 1 year. That was 12 million. So that then leaves us with 6 million of net current assets, which is a truer reflection of the position. However, within that, we've got restricted funds, where we can only use it, for example, on capital type of purchases. And then if we take the long-term perspective and look at our long-term liabilities, we have our bank loan, we have our VAT that we have to pay. That totals 15 million. And on top of that, we've got provisions in other stuff like that. So that's where I believe the Audit Scotland report had missed the other side of the equation, whereby we've seen the cash and cash equivalents, but what about the liability side? That would have been better to read together.
Very interesting answers there. The Audit Scotland report puts your college at £57 million in reserves.
57 million is actually the income and expenditure carry forward, which are surpluses that are coming through the income and expenditure account every year. Okay.
We can talk about that at the next session of the committee, but what you're describing to me there is a range of options and obligations and commitments that are already earmarked, but nevertheless it seems to present a picture of choice. In some cases choices can be made about how to deploy that money, and I was interested that the money isn't in any bank accounts and it's not real money. I really have to pursue that at another stage, I think, convener. But it was to ask you in future, we do know that there are plans developing about how to treat college surpluses and how to deal with them when you do become public bodies next year. And there's discussion ongoing about that. Just what are your thoughts about the best deployment of that?
Start there. I think we would be remiss if we weren't making the point that due to the different accounting principles that are going to be coming in to the sector under ONS, we will be recording a massive deficit across Scotland for the sector. It's in accounting terms, but there will be, with the transfer into arm's length foundations, colleges will need to show that transfer of cash into a different body as if we were spending that money. So colleges in future under ONS restrictions will show deficits in their accounts. So it will look as though the college sector is insolvent.
£214 million worth of surpluses. I don't understand that, but we can come back to that, I think.
Perhaps I could speak on the issue of the surplus. At the moment, my college would have did have a financial strategy to try and generate 2% of our turnover as surplus, which would be somewhere around about maybe £500,000 per year, which we did earmark for specific projects. Our financial strategy will now change. We do not have the capacity within the college to generate that level of surplus. And that's not because we're going to reduce in any way any of the commercial activities that we do outside of our public funding. It's just that we will have to use the money in year to try and ensure that we can maintain the level of service and quality to our students going forward. So how we generated surpluses will remain, but the level of that surplus will diminish, and I'm sure that will be the case across the sector. I was interested in one of the things you had said there about when we become part of, we become public bodies. We absolutely respect the decision of Parliament with regard to ONS. We understand that the Parliament has made that decision. However, it further confuses an already complex position. We tend to be of the public sector, but not in the public sector, because at the moment, our academic and financial years run as the universities do. That's going to have to change because we are now classed as public sector. On the other hand, we are not party to public pay policy. That doesn't apply to colleges. We will have to be a public body in terms of our accounting practices, but in other ways we're not. We're expected to, be very competitive, not with each other, but with external providers and generate income. So we really we're a real chimera. We're bits of everything. And that sometimes is very difficult, especially for staff who see that's great, we're back to being the public sector and that will give us a level of stability because the government will have to look after us. And in fact, that's not the case. So we understand why ONS is with us, but the issue about are we public sector or are we not is one that will continue to cause complications for us as college leaders and our boards going forward.
For that. I had some specific questions about West, about the relationship of students in Clydebank and Greenock and Paisley, etc. I think we'll maybe just write to you about that. I can raise that with the committee. There was one thing, however, I wanted to ask in public, and it comes back to what Alan Williamson had said about the cash and cash equivalents. The Scottish Funding Council recommendation is that the good practice suggests that there should be a minimum of 60 days. That in the past in Redcare College, Redcare College had less than 1 day, which is quite a significant departure from the good practice guidelines. What are the what was your comment on that? What are the implications?
The strategy as it was at Redcare College back in 1999-2000, when the college was going through some severe difficulties, had a significant deficit position, very, very poor estate, and the decision taken by the board as it was and the senior executive at the time was that it was not appropriate to stockpile cash reserves, is that any monies we generated we would absolutely reinvest back into that college for the benefit of the community, reinvest into the estates. If I can give an example, over a 10-year period, £21 million has been spent on that particular campus, of which only £6 million has been supported by the Scottish Funding Council, and that's where the college actually generated income itself to help pay and use bank loans to pay for that improvement for the benefit of students and staff, and absolutely had a strategy of working on an overdraft for that period, and has done that for 12 years successfully. And I absolutely believe at that point, with the funding environment we were in, was appropriate in terms of reinvestment. It's not appropriate going forward in the case of West College Scotland with the funding environment and context that we're currently in. We have a target this year of 35 days cash. That goes up to 37 days next year, although it becomes irrelevant after March 2014 in the sense that we will hold a level of working capital which amounts to about £3 million.
So, given that you're aiming to 35, 37 days, should the Scottish Funding Council guidelines be reviewed?
I really think it depends on the size of the college and what their turning liabilities are as you go through the year, and each college would have to separately have a look at their own situation. It also depends on how quickly you're turning your debtors into cash, which influences how much cash you really want to hold, because it's really to do with your short-term working capital. And there, I've always thought certainly between the 30 to 60 days at least gives you that headroom to be able to deal with liabilities should you have a problem bringing in some of the income side of it.
Okay. Thank you very much, and thank you for your contribution to the committee. There may be further questions that we have, in which case we can write to you if need be, but thank you very much for your time. Yeah, we'll just take a couple of minutes to allow changeover. Reconvene and welcome our next panel. Lawrence Howells, who's the Interim Chief Executive of the Scottish Funding Council, Martin Fairbairn, the Senior Director, Institutions and Corporate Services, and John Kemp, Director of Colleges and Post-92 Universities. And I think, Mr Howells, you want to make an opening statement?
Yes, thank you very much. Thank you for inviting us to give you evidence today on the Auditor-General's recent report. We've worked closely with Audit Scotland as it developed the report, and it contains a range of useful points. I'm very delighted that the report records that the overall financial standing of the colleges remains good, and I welcome the recommendations the report makes for us as an organisation and the encouragement that it makes, particularly to continue to develop outcome agreements and the process with colleges. It's worth saying that I'm here in my capacity as the Scottish Funding Council's accountable officer, and as such I'm responsible for delivering the government's policy objectives and the deployment of resources to that end, and for the planning and risk management necessary to do so efficiently and effectively. I think it's also worth just recording some of the progress that the sector has made, and I welcome the comments that were made earlier about the good progress that the colleges have made in regionalisation. But it's worth saying we now have 27 colleges who've decided to merge into 10 colleges of scale and influence across Scotland. Working with the new regional college structures, student activity remains constant or slightly increased between 2012-13 and 13-14. We're about to start negotiating a third round of outcome agreements with the colleges, and with the sector we see that these outcome agreements will enable us to further improve that system. And we've started the process of allocating our funding to reflect need more accurately. Reform, of course, is not yet complete. We need to maintain the momentum on the college mergers and make sure that they actually deliver the benefits that they're intended to deliver, the benefits to learners, communities and employers. And we'll work closely with colleges to do so. As I said earlier, outcome agreements is a key method for the future for creating transparency around public funds and what they're used and what are delivered for them, and the contribution that the college sector will make to Scotland. As I say, it's only the third round that we're just starting. We've only actually had 2 rounds, so it's an opportunity for us to up our game in terms of those outcome agreements. And we'll continue to support the enhancement of quality within the sector, working with the sector, with the College Development Network and with Education Scotland. And of course, finally, we look forward to playing our part in establishing the new regional structure established by the Post-16 Education Scotland Act, and particularly the regional college boards, which will particularly focus in Glasgow, Lanarkshire and in the UHI. So with that, I'll close.
Okay, thank you. I don't know if you were present when we had a discussion towards the end on the cash and cash equivalents and the Scottish Funding Council guidelines of 60 days. In the past, 2011-12, the report from Audit Scotland shows that only 6 colleges actually met that 60-day guidelines. What's the point in having that guideline if colleges are just ignoring it? And how do you actually monitor whether they're meeting it? And what do you do if they're not meeting it?
We were here for that discussion, but I'll pass over to my colleague Martin to answer that.
Okay. The Audit Scotland description is broadly correct, that we have that guidance. However, it's primarily, I should clarify, it's primarily guidance for us internally within the Funding Council when we're reviewing the financial situation of each individual college. And essentially we use it as a gateway to say, for starters, what does the overall cash and cash equivalent situation look like? If it's round about that territory, then we swiftly move on. If it's below that, then we say, well, either looking at the accounts in more detail or indeed discussing with the college, what is the financial situation, how is it managing its cash flow on a day-to-day basis? And we were here when Audrey Cumberford was describing the situation in Reid Care. We have, over the years, had very regular conversations with Audrey and her predecessors about how they are doing that on a day-to-day basis, because that's, I think Audrey would admit, a more challenging thing to do when you've got less backup sitting there. Will we need to change that, if you like, even if it's an internal rule of thumb, will we need to change that? Yes, we will, partly because of the reclassification of colleges changes the nature of our month-to-month interactions, whereby it will be more one where colleges are projecting to us what they require for the next month in terms of cash, and we need to manage that across the sector so that colleges are able to pay their bills on that month-to-month basis, and therefore will be able to operate with less of a buffer on a day-to-day or a month-to-month basis.
Do you have any concerns then that if colleges in future have to operate with less of a buffer, that they have no reserves to, or little in the way of reserves to fall back on, that that could cause problems if they're having to operate on a month-to-month basis?
We, with colleges, will need to strike a right balance between, on the one hand, ensuring that colleges have enough cash or working capital to operate on, might be best to describe it, convener, on a week-to-week basis. And we've got slick processes in the background whereby if there's a sudden change in week 3 of a 4-week month in a college's cash requirement, that we can respond quickly in order to deal with that. That's the whole nature of one of the changes that flows from reclassification, that colleges will become more like non-departmental public bodies that draw their cash down as they need it. But it's a balance to be struck, because we don't want to be doing that every day of the week.
Yeah, can I explore that then? Does that mean that the Scottish Funding Council will be more actively involved in, if you like, overseeing the management of colleges in a way that it hadn't done in the past? And does it then mean that you will need to expand your management structures to be able to adequately do that?
We, in terms of that cash management that I was describing, yes, we will be more, there'll be more detail required, because at the moment we decide on the total amount of grants we're allocating a college or a university over a year, and then we simply set out in advance the profile of payments we will make for that full year, and we don't change these unless there's very exceptional circumstances. From April onwards, essentially the same approach will be taken, and we'll say there's the total amount for the year, but on a month-to-month basis we will ask each college what its projected cash requirement is for the month to come, and we will, as long as that's reasonable, that's the amount of cash we will pay the college on that month-to-month basis. So it will become a bit more involved, and yes, we will have to adjust our own internal resources and staffing in order to cope with it. But it's not a huge step on that cash flow management end of things from where we're at the moment. So it's not going to have a huge impact, and we feel we're going to be able to cope with that internally. I think, though, you were asking something a wee bit more general about just the general management of colleges. Would that be correct? Yeah?
Not necessarily. It's about how colleges will cope if they don't have reserves to fall back. You mentioned that you used the word buffer. It's about what the implications would be if that buffer is not there.
Right. Essentially, at the moment, we have a similar situation, except we're sitting on a different part of the spectrum. We have a fixed prediction of how much we're going to pay each college each month, and that's pretty much what we stick to. And colleges have their own cash buffers, reserves, whatever you want to call them. What we're doing is we're moving a bit more along the spectrum towards they have less cash, but we have more interaction with them to be more precise about the amount of cash they need each month. So we'll still have that balance. Each college will still have a working capital, cash reserve in order to manage day-to-day requirements, but there'll also be a bit of a closer relationship with us should that prediction change within the month.
Just one further question about your increasing involvement. In the past, there have been criticisms that at some colleges, senior managers were given enhanced pension packages and redundancy packages, partly in order to slim down for changes that were made. But the concerns have been expressed that there wasn't a great deal of clear accountability, and that senior managers, arguably to some extent, were looking after themselves, that they made sure that salaries were put up ahead of retirement, that the enhancements were put in place. Will you have an increased role in determining what financial packages are being made available to senior staff who are taking early retirement or redundancy?
We've issued guidance to the sector about severance packages, and the boards of the colleges are required to follow that guidance. The actual decisions about individual payments to senior managers are, of course, a matter for the board. They aren't a matter for us. The guidance sets out the governance process that should be followed by the colleges and the matters that they should take into account. And we expect them to follow that guidance, and that will be the same in the new structure as it is at the moment.
Okay, would it be possible to send the committee a copy of that?
It would, yes.
Thanks. And you say that you will have no say over the salaries. Now, now colleges are now being treated, I think we heard, as almost like government departments, and there are government structures and government guidelines. Are you suggesting that despite that, colleges will still be free to set their own salaries for senior managers?
In Scotland, in fact, across the UK, there is no one single categorisation of public body. That's maybe unfortunate, but it's a fact. And as one of the previous panel was saying earlier, colleges will, and in fact do at the moment, exist in a mixed economy around about public body status. ONS classification at its simplest is simply about the Office of National Statistics literally moving colleges from one table of reports to a different table of reports. But government across the UK has for a long time used the classification that ONS uses to determine other things, such as what financial rules apply to the management of different bodies' finances. The clearest and most obvious change that impacts on incorporated colleges is that they will have to change their financial year, and committee members may have well seen that in the Scottish Government's draft budget there's further information comes in to show projected gross expenditure and so on. So there's these sorts of technical changes happening. But it also impacts on how colleges manage their finances, their cash, as we've just been discussing, from year to year. There's then a range of potential, and it is just potential, other implications for colleges as well, most of which flow from the Scottish Public Finance Manual, that range from reporting arrangements for gifts and losses to how colleges manage their pay and so on. Scottish ministers have said around about application of the Scottish public pay policy that they will not apply that to colleges as a result of the reclassification. And there's a range of other matters within the Scottish Public Finance Manual that are under discussion to see whether or not they make sense to apply to incorporated colleges. So it's not simply they're reclassified and bang, a whole set of standard stuff applies. It's worked through on a case-by-case basis.
You'll be aware that in recent years there has been concern expressed about the salaries of principals and senior managers in our universities, where they almost operated as a cartel, that the wages of one would increase at the same time as the wages of others in other institutions. And very few of them are now earning, I don't think anybody's earning less than £200,000 a year, and it's maybe in excess of £250,000. We also saw in recent years the salaries of principals of colleges increasing quite significantly. Will the Scottish Government, through ministers, or will the Scottish Funding Council have any leverage or any influence if the boards of colleges decide to influence or decide to increase the salaries and other remuneration payments and retirement packages managers, of senior managers and principals? You know, is there anything you can do about it if college boards decide just to go for it?
Range of things in there. I'll deal with the last bit first of all, which is around about severances and so on. And just to add to what Lawrence said, we have our guidance there and we'll share that with you. The guidance also includes procedures whereby the arrangements have to be reviewed by the college's auditors, and if the arrangements at a college or university, that's the same rules applies to each, are stepping beyond that, then they have to report that to us. Over, I think, the piece, given the public interest in this area, it's one that we will be taking a heightened interest within the existing framework of rules that we've got over the next 2 to 3 years. But ultimately, colleges are autonomous bodies. ONS reclassification does not change that, and therefore these are matters for decision by the boards of management of the individual colleges.
The auditors have been singularly ineffective in both universities and colleges in constraining the pay and conditions of those at the top, and it doesn't suggest to me that there's going to be any change for the future unless the Scottish Funding Council decides to operate in a more aggressive way. But I look forward to seeing what comes out of your deliberations. Mary Scanlon.
Yes. First question is very brief. Do you still anticipate that the merger programme and other reforms will generate £50 million of savings every year from 2015-16?
Yes, we do. The evidence is that as a result of the reform process, colleges are able to deliver. Actually, colleges are delivering an increased number of students, around 7% increased number of students, at the same time receiving around 4.5% less reduction in funding. That's since 2012-13. If you combine those together to make a real terms efficiency gain calculation, that's around 49 million. And that actually is a slightly different situation from what we originally expected, because, as you know, earlier this year, the government put additional money into the college sector, and that's what's allowed the number of students to grow since 12-13. It's important to see that that's as a result of the reforms that the colleges have taken through. They've restructured the colleges. They've moved into a smaller number, and as I said earlier, 27 colleges moving down to 10.
My second question, as a Highlands and Islands member of the Scottish Parliament, I'd just like to ask about the UHI, because it is a very different financial status to other colleges. It's my personal concern that the 15 million plus that's used to run the UHI administrative office and the over 200 staff, that money is top sliced, as is often said, before it gets to the colleges. That is different, obviously, to every other college in Scotland, and also the fact that numbers can be less in remote and rural areas, so it costs more. Is it a concern of the Scottish Funding Council that in time colleges across the UHI network may be given less to teach per student? I just wonder, is this a matter of concern?
Our expectation is that the maximum amount of our funding gets to support learners and their studies. That's absolutely right. And we would be concerned if money was being top sliced, to use that phrase inappropriately. It's important, though, also to remember that some of that money that's held centrally supports library, IT infrastructure, the development of the network as a whole, and so on and so forth. We will be, as part of our discussions with all institutions and all the regional boards, asking them to demonstrate how the maximum delivery is provided for the money we provide. And in the case of UHI, I think one of the key functions of the FE Regional Board will be to bring that together and make sure that that is how the money is used.
My final question is on ONS. I'm not sure if you were in for the full discussion earlier, but we did have quite a comprehensive discussion, and the 3 college principals raised a variety of concerns. I'm sure none of them are new to you. But within the report, the Auditor-General does say something along the lines of the SFC is looking at ways to minimise the impact of government budgeting rules on the college sector. And we also heard about the setting up of arm's-length trusts. Given that when this report was written and the fact that this is implemented on the 1st of April, I wonder, Convener, if you could give us an update on where you are with these arm's-length trusts.
Indeed, yes. I'll pass over to Martin.
We have the Scottish Funding Council set out now, and that's on our websites in the public domain, a significant amount of guidance and templates. For example, trust deeds is not the correct technical term, but articles of association, that sort of thing, for the arm's length foundations. We, the Scottish Funding Council, are establishing what we're referring to as an umbrella foundation. That is an option that is open to colleges to participate within, if that is their choice. And the material we've published on our website is essentially describing how we're setting up that umbrella foundation. We are currently looking for trustees to serve on that umbrella foundation, and I understand that they should be identified within the next couple of weeks, working with the colleges that have expressed interest in being part of that umbrella foundation. However, the majority of colleges, vast majority of colleges, have indicated that they wish to establish their own arm's-length foundations for a variety of reasons. I can go into that if it's of interest to the committee. And they are using, if you like, the templates and the guidance that we have made available on our website to establish their own. I had a meeting yesterday with Michael Yule, who is one of the regional leads who is particularly working in this area, and he described to me how across the piece colleges are now making good progress in establishing their own arm's-length foundations where that is their choice. So at the moment I am reasonably confident that all these arrangements will be in place in time for 1st of April. But that would bring me back to the Umbrella Foundation. If any college hits a difficulty in some sort of regard, they can fall back on the Umbrella Foundation that we are establishing to use if that is necessary.
Right, I understand, I think it was the acting principal of Perth College, if I am correctly quoting her, I think she said that only 3 colleges voted for your Umbrella Foundation. And I appreciate that it's a moving feast. Can I just say, why is this reclassification appropriate for Scotland? I understand that in England, the government actually brought through legislation to ensure that colleges could continue as they were instead of becoming basically government departments. And my second question is, we heard from the principals that around 30% on average of their funding is not public, not from yourselves. So of around 30 to 35% of college funding is to be held by arm's-length trusts. As the convener said earlier, how does that make the colleges more accountable to this Parliament? And I suppose really, Mr Howells, as the accountable officer, has this measure led to colleges being less accountable to the taxpayer? Because I'm not sure what relationship we will have as an audit committee, as a Parliament, or you will have as the Scottish Funding Council with these arm's-length organisations, 30% of college funding, which is totally independent. So to me, that seems we're 30% less accountable.
Firstly, of course, the 30% funding won't actually necessarily go to those trusts because most of that funding will be earned in a year and spent within that year. It's only the balance that isn't that might be put into the trust. The second point is that the trusts will be they'll be set up so that their purposes are aligned with the purposes of the college sector and with us, and the rules on which they'll operate will support that. And finally, of course, when the money actually is spent within the colleges, it's actually part of their normal process and their normal accounting element. I'll pass over to Martin because I think he'll give a little bit more detail.
Accountable officer, I think it was the lady from Perth, she did say 25%, 21% of their income was from other sources in this sense. But can I also say that that money that is within these trusts, which we hope will be 100% spent on training and education, can I just get from you, Mr Howells, that you have no responsibility or remit over that money? It's really got nothing to do with you unless it's within the college budget. Is that correct?
They become independent trusts, of course they do, but they're only going to be allowed to be set up if they conform to, the articles conform to a standard. And that means that at the end of the day, when that money is spent, it will be spent within the college sector, within the region, by the region.
But you didn't answer my question.
Sorry.
Am I right or wrong in saying that you have no responsibility for the money while it is being held within that arm's length trust?
No, I don't.
Thank you.
Okay. Anyone else want to follow the issue of these trusts before we go on to other things?
A matter of fact,
yeah.
It is not the case. I understand Mrs Scanlon's point on arithmetic on the 20 to 30% of college income that comes from other sources, but that is not necessarily what will be lodged within arm's length foundations. If the college spends the whole of that income during the year, it will never go near an arm's length foundation.
I think the thing which, I'll just let you in a minute, James, yes, but the thing that came out of the previous evidence session was that you would have no influence or control because they were independent, but actually neither would the colleges.
That's right. Yeah.
So who then has the influence and control, and to whom are the trusts accountable?
I wasn't making a change to that analysis. It was simply the numbers analysis. But the answer that Lawrence gave earlier is correct, and it's necessary indeed for the establishment of the arm's length foundations and for them to sit beyond public sector accounting. Yeah.
To whom are they accountable?
Trustees are accountable to their own trustees to ensure that they stick to that.
So they're responsible to themselves. They're not responsible to the colleges. They're not responsible to you. They're responsible to themselves.
Yeah.
That's the legal position.
Yeah.
We will be looking for information on a regular basis from colleges and ultimately from arm's length foundations. But I can't take away from, you're quite right, there is that bit of clear blue water which is legally necessary.
But at the moment, we don't know how much money will go in there. It might be a tiny percentage of that 25 to 30%. It could be a substantial chunk of the 25 to 30%. And any college that wants to make sure that money doesn't go back to the Scottish Government or to central sources, could transfer the money to that trust. Yeah. And then once it's transferred to that trust, no one has any say over it other than trustees who are only accountable to themselves. Right. So how is that transparent?
We will seek transparency in terms of the reporting up the line from the individual foundations into the colleges and to ourselves as well, to understand what the flow of monies have been and what the use of the monies are. But I'm not taking away from the accountability point.
Yeah, but once they're established and once the money's there, they can actually do with that what they wish, and you've got no say over it, and the college has no say over it.
They can only do with it what they wish within the terms of their trust deed.
Yes, but if they interpret that imaginatively, it's up to them. It's not up to you, and it's not up to the college. So, in a sense, there's a leap of faith there that we're going to see what we expect to see, but the Scottish Government has no say or control. This Parliament has no influence. You have no influence. And indeed, the colleges have no influence once the money's in that bank account. Is that correct?
In a legal sense, absolutely correct.
Right. Well, not just in a legal sense, in any sense. It's gone, it's there, and it's up to the trustees what they do with it. Sorry, James, you would want to come in.
Yeah, kind of just on that point. Would it not be dependent on how the Articles of Association or whatever are written, that there would be very clear strictures on what the trust is allowed to do with the money? And would there be safeguards in place to make sure that the imaginative thinking that the convener talks about couldn't happen?
That's correct, and that's why when we're setting up the umbrella trust, we're trying to do that in a way that provides a model for all the other trusts if individual trusts are set up.
So would you be advising them to use a model similar to yours, if not exactly the one that you're using?
That's exactly what we're doing, and we're looking to get copies of the individual foundation trust deeds to see the extent to which they vary from the standard template, and if they vary significantly, then we will look to discuss with the individual areas what the reasons are behind that.
And can I just further to that, you have no control while that money is in the trust, but when the money is out of the trust and back in the colleges, would you then be taking control in terms of how that money is spent?
Yes, in just the same way as any other money that's spent by the colleges.
I mean, the arm's length thing is not a new thing. I'm from Glasgow, and we have a number of arm's length for very major organisations, so I'm sure we'll get work a way around it to make sure it works fairly.
Okay, right. Who else is wanting to come in now? Colin, you want to come in?
I'd like to ask a basic question I haven't quite got my head round. What is the process that you follow to determine how much funding each college actually gets?
Can I paint the picture in the regional environment, which is where we're heading, if you like? Where we're heading towards is that we will make an estimate of the need of that for that region, the need for funding, and we will use principally demographic factors to help us decide what that is. We then have a method of estimating the amount of funding that's required for that region based on the number of students, an amount per student, a price per student, and that will give us a benchmark for the amount of funding that region should have. We will then have a discussion with that region about their needs, about the situation that they're in, and any special factors we need to take account. And as part of our negotiations of an outcome agreement with the institution, we will try and seek a match between the amount of funding we provide and what they deliver for that money. We're in a transition at the moment. We're in a transition from our existing system where funding for regions is essentially historically based on recent past with adjustments that have been made. And one of the key things that we need now to do is to manage that transition effectively. And the letter of guidance we recently had from the Minister gave us some rules, if you like, some advice about how we should manage that transition. And one of the key messages in that guidance was during this particular period of change and transition in the college, we need to take account of the stability of the sector. So that leads me on, if I could take advantage of this opportunity, the Principal of Clyde College mentioned some potential changes to our funding method that we're making at the moment, and was suggesting that she needed further information. That is part of the process that we're in at the moment. We don't intend to introduce a new approach to our funding without discussion and without proper transition arrangements to take people from where they are to where they need to be in the future.
Does the process include getting bids from the individual colleges for funding?
Not for the core funding for teaching. If it was for a special initiative or for a building, that would be a different matter. However, as we're moving into the new world, we do want to hear from colleges and have a chance for them and the special circumstances of their region to influence how their funding changes over time. So we do want to move from a system which in the past was very rigidly formulaic. We simply calculated a number and that was what people got. We want to move to a system where there's an opportunity for local dialogue to influence that. And particularly to help us deal with issues like, for example, if you've got two adjacent regions, what's the best way of serving the needs of both of the populations, particularly where people maybe wish to travel between the regions?
Sounds very top-down driven.
I think the core thing that we would wish to found our funding on is the needs of the population, and trying to make an assessment of that, both from demographic factors and from dialogue with the regions who know their local region better than we do, but to try and balance that up across the country. That's what we're trying to seek to do.
Our intention is that it will be driven by demographic evidence, economic evidence, and through negotiation with the college or the region as we develop the outcome agreement. So, I mean, our intention isn't that it's top-down, but it's driven by evidence.
Seems, if I was a college, I think that was a wee bit uncertain about how it all works, to be honest. I think that I'm not clear as to the input of the colleges here. I mean, are you protecting their core funding, and then outside of that, it's sort of a bit of bidding, a bit of justification to get the money?
The guidance letter to us says, firstly, guarantee that no region loses more than 1% any 1 year. So that's a kind of tram line. But we will be starting from the basis of saying, well, what is your current funding? What does demographic change suggest that your region might need to grow to or change to over a period? And what information have you got in your college that give us a special indication that you need, some change to your funding? I think we take the view that colleges have been through a huge amount of change at the moment. We need to establish a longer-term process whereby their funding, if it changes over time and most effectively reflects need. And that, I have to say, in the past, our method was extremely top-down. It was a calculation on a spreadsheet that was just handed to colleges. I think we're introducing a new element to enable a proper dialogue to get the best outcome for the students and employers and other communities in the region.
Just a second question on pension deficits. Obviously, there's a deficit that the Auditor-General has highlighted of 115 million, which may go up, may go down. How do you monitor that? Do you have any concerns with it? And how do you see it being handled in the future?
Can I pass to you?
Yeah. How do we monitor it? First of all, through we've got a process we've had for some years, whereby we monitor both colleges' accounts and their financial projections. We're now building that into our outcome agreement process as well, so we understand how they're going to be meeting the whole array of their obligations, including their pension contribution obligations, going forward, whether it's local government scheme or whether it's the Scottish Teachers superannuation scheme. So if you like, our short to medium term focus is on how are they going to meet their actual cash obligations in terms of pension schemes, paying their employer contributions. So that's part of their whole financial forecasting and our overview of the robustness, the sense that is there within their financial forecasting. For the longer term, what pension deficits are indicating both in the college sector and, of course, more widely across the whole of the public sector is a challenge between, on the one hand, the growing strain as a result of an ageing population and so on, and economic turbulence that we've had over the last few years. And to be honest, that really begins to get beyond our remit, to get a handle on. What all we can focus on is that short to medium, over the 3 to 4 or 5 year type horizon, to ensure that we have an understanding of how colleges are going to meet their employer contributions over that time period.
Will there be a point at which you would have a real concern over the size of the deficit? Is there any trigger point?
I don't think it's so much the size of the deficit that's a trigger point, or if there's a concept of a trigger point. The challenge is around about the rate of employer contribution, which is now, of course, much higher than it was 10, 15, 20 years ago. I mean, at one stage with the local government scheme in Lothian, for example, I remember it was 0%. These days are long past when it was at that level. Now we're up around about the 20% type mark, maybe having to move higher as a result of future actuarial valuations. Might it hit 30%? There are some schemes kicking around outside of the public sector that are into that type of territory. I think that then becomes very challenging if there's not other moves in the public finances for any public sector organisation.
Thank you. Ken McIntosh.
Just picking up from, the points that were raised earlier by the principals about the methodology used to calculate student funding. The Auditor-General, in fact, in her report suggested that she expected the average level of funding per student to fall. But the principals weren't sure if that was the case. Do you think it will fall?
Sorry, I didn't hear.
The Auditor-General suggested that the average level of funding per student will be reduced, will fall. She says, I think here, it's paragraph 41 of the report, page 15. However, public sector spending reductions mean that the level of SFC grant support per student is likely to be reduced. Is that the case?
Per FTE, yes.
Per FTE, that's correct. I think the principals were also referring to how we allocate, that would be the sector average figure, how we allocate the funding between different regions. And they were referring to an uncertainty about how we're going to do that. And that's part of the dialogue we continue to have with the sector to resolve that over the next period and to make sure that actually colleges are able to smoothly move from the old system to the new.
Just confirm that the average amount of money per student is going to be reduced under this new system?
Yes, in real terms, yes.
In real terms?
In real terms, yeah.
Okay. And there was a specific worry about the impact, development education, so I should say support within the system for students and young people, or all students with any additional needs, has already been dramatically reduced, has been dramatically affected by the spending cuts, particularly in terms of development courses. They were then talking about the ESL funding, which is a specific formula that you use. Are you able to offer any reassurance here that this will not affect accessibility of students with additional needs?
I see no reason why it should. I think, again, this is one of these transitional issues. Colleges will need to adapt and reflect on to any new system that we implement. But our intention is to implement it, in a paced way so that isn't an issue for them. I felt there was an implication earlier that our funding for ELS was currently cash limited. It didn't have a limit. That's not the case at the moment. It's as it will be in the future. It's all part of existing colleges. They have to balance priorities within it. That will not change in the future.
Yes, but clearly they're concerned that the changes will have a disproportionate effect on those with additional needs. Is that the case, or is that not the case?
I see no reason for that to be the case. I think it is. I think what we're hearing today is part of a transition between what might be our new method of funding at the moment, which we still haven't fully determined, which we are working through with the colleges. But we're absolutely committed to the fact that that would not be the case, and that our changes to our funding method would not impact disproportionately on people with disabilities or people with additional needs for education.
Something you said earlier about the fact that colleges have additional funding surprised me. The Auditor-General suggested that the Scottish Government, the reductions in spending introduced by the Scottish Government affecting colleges between 2011-12 and 2014-15, the three-year spending review, will amount to 24.1% in real terms, almost a quarter in real terms. Now, there was a slight additional revenue grant, 17 million in the budget changes this year, but a 24% cut in 3 years. Can I just ask you, what is the real terms? I assume it is a reduction. Is it a reduction? You're talking about an increase. I imagine it's a reduction.
In terms of the college's overall funding, there is a real terms reduction, as you said. That's correct.
How much would it be?
Let me get my...
It depends where you're starting from and finishing.
The spending review period from 2011-12 to 2014-15.
General had provided to said that in 10-11 to 11-12 there was a 9% reduction, and then from 11-12 to 14-15 there was a further 11% reduction.
Yes, we agree with the figures that the Auditor-General has provided.
The impact of those, we heard some discussion earlier. The principal suggested that already there's been reduced access in terms of opening hours. There have been a lot of job losses, and there are more job losses to come. They weren't able to answer on headcount and student headcount. Do you expect student headcount to fall?
Student headcount has fallen over the period. If your question is, do I expect student headcount to fall again next year, I don't see any reason for it to fall. It is one of those difficult things to predict. The target that we set for colleges is a student activity target, and that's the measure of the volume of activity that takes place. And we that is the key measure that we ask colleges to account to us for the volume. We don't specifically measure or manage the headcount in colleges. In the recent past, there has been a reduction in headcount. That's substantially due to changes in our guidance to colleges about getting rid of short courses or very, very part-time courses that generated a lot of headcount but relatively small amount of student activity, and the shift towards prioritising young people, full-time provision for young people. Those shifts are part of the policy that the government set out and are part of a move towards a sector which is more attuned to delivering outcomes for students, for the economy and for society. And it is important to note that some of that shift over a significant period has been about changes to how colleges provide courses that you might typically describe as at the leisure end of the spectrum towards courses that are more substantial. I think that I don't see any reason that should change further in the future. We're certainly not intending to issue any guidance or advice to the colleges that would change that.
Just if the evidence we heard from principals suggests that there have already been a number of job losses, you're hopeful that the headcount won't fall anymore, but the class sizes will increase. In some cases, the hours spent in front of those classes will decrease, and that development education itself has already suffered, may or may not suffer, depending on other changes. Are you concerned that this will affect the quality of education and further education?
We monitor the quality of education through two routes. The route through the activities of Education Scotland acting on our behalf to review colleges, their provision and how they organise their quality arrangements within the colleges. At the moment, we're not seeing any particularly worrying signs from that route. We also manage the quality of education through our outcome agreements, where regions are asked to articulate their targets for improving or maintaining retention. And indeed, I'm delighted that that the colleges have been able to commit to improving retention rates during next year. We would look to see that continue, and we would be asking the larger regional colleges strategically to keep a relentless focus on improving their service to their students and their communities, and being able to demonstrate that much more effectively than we have ever done in the past through the vehicle of outcome agreements.
One final question, Convener, if I can. You're suggesting earlier that you had guidance about the use of severance payments. I conducted an FOI about colleges about the severance payments, and the figures that came back where the severance payments rose from, this is 2007-8, from 1.8 million in 2007-8 to 3.8 million in 2008-9 to 4.5 million in 9-10 to 18.6 million in 10-11, slightly reduced to 16.3 million in 11-12 and 10.4 in 12-13. Is that, these figures, that's a substantial increase at best. Do you think that they have all followed your guidance in this case? Or are you concerned that your guidance has not been followed?
We have had no indication that they haven't followed the guidance, and some of the figures you've quoted there are into the period when the mergers were happening, and we would have been funding at least some of those severances. And we have made it quite clear that where we're funding the severance, that it has to have a one-year payback. So that the scheme overall that a college runs has to be one that if you spend £2 million, it reduces the staff bill by £2 million per year. And by and large, colleges have been sticking to that, because we will fund no more. And it's only in very few examples have they used the reserves to fund things that are more generous than that. If you look also at the total cost, the number of people that were going in the earlier period before the mergers, the average cost per staff member going, compared to other public sector severance packages in the Auditor-General support, is at the mid to lower end.
Yeah, clearly the number, just in the last 3 years alone, there's more than £40 million been sent in severance payments. There's something like 2,500 people have been laid off, although clearly a lot more have been then taken on. Do you think that's good value?
That's been done at a time of very considerable restructuring within the sector, and a large amount of those, particularly in the latter period, will have been related to the mergers. And they have restructured their managements quite considerably in that time. with the intention of producing a leaner and differently shaped service that I think is good value for money.
Okay, thank you.
Final question, Bob Doris.
Thanks very much, Convener. I know time's tight, so I'll try and keep it really brief. Okay, from a significantly reduced baseline when of rising budgets and rising student numbers, but I put on record that it is from a significantly reduced baseline following merger. Question I was asking earlier on was in relation to how colleges are getting a better grasp of student demand in their areas, and it flagged up as a concern and a key recommendation within the Auditor-General's report. How does the Scottish Funding Council work with colleges, say in Glasgow, for example, the area I represent, to actually get an accurate picture of demand? The example was given about one student could trigger 10, 15 applications, and the raw data would show that's 15 demands for a place, but it's actually one student needing placed.
Our key method of working with the colleges is through the dialogue we have through our outcome agreement managers. And one of the things we expect in an outcome agreement is a contextual statement about the situation in that region. Of course, part of this is simplified by having fewer colleges, because you've got a more integrated system that you go forward. And we'll be looking for, particularly, for example, in Glasgow, we will be looking for agreement with the region about a sensible, well-planned curriculum for Glasgow, for the whole region, that takes account of all the context for that region and enables us and that region to plan sensibly for the development of that region, taking into account a whole range of factors, which were population, student demand and the needs of the economy.
Not sure what that means in practice, but I'll look back at the official report for what you said there. I have to note that I know colleges did always seek to work together, but there was an impression in areas that they were actually competing with each other for the same students, which led to not using the system as efficiently as possible. Second question I was going to ask was in relation to coordination at a regional level rather than duplication. Give one very brief example and ask you how we can improve this. Student wants to do and this is a real example, student wants to do an NC course at one college within Glasgow pre-merger. There's credits for that, but the HNC course doesn't, because they haven't done enough credits, they can't articulate to the relevant HNC course. I've heard stories you can't articulate from HNC to HND, and the college, there wasn't just duplication within the college regions before, but actually they didn't articulate the courses with each other. As the Funding Council, actually I have to say I would have hoped that previously you wouldn't have funded courses that didn't articulate with other courses, but now will you be asking the regions to show that there is that articulation and progression before you actually give them the money to fund the courses?
One of the things we want to do, not just in the example you've talked about from NC to HNC and so on, but for the whole of the learner journey, from somebody leaving school or entering college, going possibly through to higher education, we want to make sure that the learner journey is more joined up. Now, the new regional colleges enable that, give us a tool that we can do that better than we have done in the past. I accept that in the past that's sometimes been difficult to do, because a lot of the courses that you're talking about will not have been designed to articulate. A lot of the HNs are designed as an endpoint in themselves. You leave with a course that has value in the market. But increasingly people are using them to articulate, and we want a system that does that better. The bigger regional colleges, outcome agreements and the work that we're doing with universities, I think will help that in the future.
Probably, was that a quick question?
Yes. Question, yeah. Hello, I don't know if you were in when the three college principals were giving their evidence, but I asked them a question about their reserves, cash reserves, and I've referred back to the Auditor-General's report here, which does seem to suggest, at least to me, that the £214 million reserves is actually real money. One of the principals referred to it as not real money and it's not held in any bank accounts. I have to say I was a wee bit disappointed with the three principals and their approach to some of these issues, but could I ask you the same question? Is that real money? And what kind of flexibility do the colleges have at the moment to deploy those surpluses in the manner in which they see fit? I think, Mr Kemp, you just said a wee minute ago that they can apply some of it to fund severance payments. And the lady that was in the middle, Mrs Monckton, when I pressed her on funding for a course that she said she didn't get funding for, I wasn't entirely clear that her response said that she could deploy her surplus funds at her own college towards that course. So what's your view on that, please?
Well, first of all, let's just state the facts. The balance on income and expenditure reserves at the end of 2011-12 were, as reported in the Auditor-General's report, at around about the £214 million level. Separately, but coincidentally, the total amount of cash and cash equivalents within the college sector at that same point, 31st of July 2012, was about the same number, but that's almost a coincidence. So is that free cash that colleges just have available to spend, as at that point, at 1st of August, if you like, 2012? No. I think Alan Williamson was correct in pointing out that that cash, to a certain extent, is committed in either a very specific sense or an implicit sense by other aspects of their balance sheet. So if you look at the total cash that colleges had at the end of 11-12, which I say was round about that same figure, about 214 million or so. But the other side, if you like, of the short-term balance sheet was commitments of about £135 million. So creditors, overdrafts, obligations under finance leases, hire purchase type leases and so on. Payments received in advance, because colleges, European funding, for example, sometimes from us, receive money in advance, and therefore that's not really their money at that point. So all of that together, if you like, knocks against that. So all the figures are true. It depends what you're asking and what what particular purpose has been thought of at any point in time. Does that help?
It helps a bit. It is real money we're talking about here.
There is real money of £214 million.
And it is in a bank account, or it's somewhere that can be accounted for.
But there's also the commitments as well that have to be met, maybe the next day sometimes.
But within those range of commitments, though, there must be choices that individual colleges can make with the freedom that remains within that.
That's correct. That's correct. They do have choices, and that's the whole point of having regional boards, individual college boards, that assess the needs of their various areas and choose their priorities.
Mrs Monckton then went on to say if they didn't have that, they would all be insolvent.
Beg pardon?
She then said at the end, if they didn't have this, when this money transfers to the trusts, when they become public bodies, if they are no longer able to access it, they're all insolvent. Do you agree with that?
This is getting a bit technical now. So, you bear with me for a second? Or do you maybe want us to set this out in writing afterwards?
I think it'd be better if it's
yeah.
technical and it's complex, then set it out in writing so that there's no dubiety. Yeah,
I'm not trying to dodge it, but I think it's getting into that territory.
Okay, thank you. Okay, I had two further questions, one in paragraph 44 of the Auditor-General's report about merger costs, and the other at paragraph 50 on the time taken for savings. I think given the time, I think we'll maybe just put that to you in writing and you can respond. Thank you very much for your contribution, and if there is anything that you think of afterwards, you can always let us know, and if you follow up on that very specific point that Willie Coffey raised, that would be helpful. Okay, thank you. Right, now back to the just now in private. Right, at this point we will move into private session.